Good evening and welcome back to one another series of national seminar with paper and poster presentation presented by Team Ayurveda. And with immense pleasure, I welcome each and everyone to this Karmanya national seminar with paper and poster presentation. Without spending much time, we can start the session. And before that, I would like to welcome our respected panel members. We welcome you all. So first we have a paper presentation, and for that I welcome Dr. Bishnupriya Sethi.
So good evening everyone, respected dignitaries and my dear friends. I am Dr. Bishnupriya, first year PhD scholar, Desh Bhagat University. Today's my presentation topic is innovation in Ayurveda. So this is collaboration of Ayush. In the first slide, this is collaboration of Ayush with the WHO, that is Global Center for Traditional Medicine in Ayurveda. The primary objective of GCTM is to harness the potential of traditional medicine from across the world through modern science and technology and improve overall health of the communities all over. Before going to the topic, let us know what is innovation. In Sanskrit, it is called Navachara Vyavaharantaram. Innovation is a process by which a domain, a product or a service is renewed and brought up to date by applying new process, introducing new techniques, or establishing successful ideas to create new value. So in ancient era, Ayurvedic medicines were prepared by the physician himself for the use of his patients. But in present scenario, because of increased population and growing demands, it becomes practically impossible for a physician to prepare medicine by himself. So large-scale manufacturing is need of global marketing of Ayurvedic medicines. So earlier, we were using, for bhasmas, we were using Kupipakwa and Putapaka method. But nowadays, it is replaced by muffle furnace. And for churnas, we were using khalva yantras for vastragalana. And nowadays, we are using that pounding machine and grinding machines. And coming to what is here, we were using by handmade, earlier we were using, but nowadays there are machines like capsule filling machines and tablet making machines. And coming to the formulations, in present era, we need to develop new formulation along with specific modification in older formulation to gain wider acceptance. Increase palatability, easy to dispensable, convenient for the patients. Nowadays, we are not only using classical formulation, but also preparing by the yukti of the Vaidyas. And cosmetics, well, Ayurveda is well known by its cosmetic products. We are getting shampoo, conditioner, face wash, kajal, each and everything we are getting nowadays in the name of Ayurveda. And coming to tourist wellness, popular destination for Ayurvedic wellness tourism is Kerala, known as the birthplace of Ayurveda. The main goal of Ayurvedic wellness tourism is to promote overall wellness and rejuvenation. It offers tourists that the opportunity to take break from their busy lives and focus on improving their health and well-being. Our government has decided to make Ayush visa for the tourists who are interested to take treatment and to learn Ayurveda. Next, the role of artificial intelligence. Nowadays, artificial intelligence plays an important role in all fields. In Ayurveda, it can be used in learning, teaching, education purpose, demonstration of procedures, diagnosis, treatment, maintaining medical records, etc. The science of robotics can be used in Ayurvedic surgeries like Sharasutra procedures and certain procedures of Panchakarma. And coming to the role of Ayurveda in preventive healthcare system. So the role of Ayurveda is mainly based on preventive healthcare rather than a curative healthcare. As we know, the shloka goes, Swastasya Swastarakshanam Aturasya Vikara Prashamanam. It is a complete health science rather than a system of medicine. It is a patient-oriented rather than a disease-oriented. Whenever we're treating a patient as a whole, we are correcting or boosting up the immune system of the body in such a way so that the multiplication of the pathogens will be stopped. Nowadays, we are getting hypertension tea bags, diabetic tea bags, many more are there. As modern science says, an apple a day keeps doctor away. In the same way, an amla a day keeps doctor away. So the use of telemedicine. Ayurvedic practitioners are now incorporating advanced diagnostic tools and digital platforms into the practice to help provide better treatments and preventive care. By the help of online consultation, patients get connected with Ayurvedic practitioners easily. During pandemic, many Ayurvedic PG students, interns, practitioners did a great job in telemedicines and got certification for their excellent work. And coming to the discussion part, so with the advancement of modern pharmaceutical science, new concepts, new dosage forms, and various administration methods have evolved. Nowadays, we are also adapting some techniques from other science to modify our medicine, sorry. So we have to follow the principles, what our acharyas have said, and with that, we can create our innovations in those fields. So lastly, I would like to conclude that we should adopt the principles and innovation methods by retainment of these Ayurvedic principles. Thank you.
Thank you, Dr. Bishnupriya.
Okay.
Next, I invite Dr. Nisarga for the paper presentation.
Good evening, everyone. I am Dr. Nisarga, third year PG scholar in RSBK department. Today, I am presenting concept of Pathya Kalpana. Introduction. Our science, which advocates more on prevention rather than cure of diseases, obviously emphasizes on the ideal food to be consumed to attain and sustain good health. Food is most essential to sustain a good life, and the same food, if consumed inappropriately, becomes the root cause of many diseases. So proper knowledge about food and its importance should be known by all human beings to have better benefits from it. It is said to be Mahabheshaja by Acharya Kashyapa. It is also quoted that no amount of medication can do any good to patient who does not observe Pathya. Likewise, no amount of medication is needed to a patient if he follows Pathya. Definition of Pathya. Pathyam patanopriti yadyuchoktam manasam priyaha pata sharira margataha anapetam anapakarakam. The root term of Pathya is Pata, which means various channels in the body, and Anapeta means not causing any harm to the human body. So any food which is not harmful for body channels and on the contrary, which is wholesome, soothing for body can be labeled as a Pathya. Significance of Pathya. Pushti Pushti Dhrutir Buddhi Utsaha Paurusham Balam Sauswaryam Ojas Tejascha Jeevitam Pratibha Prabha Ahara Deva Jayante Eva Madhyam Gunam Drunam Tadatmam Hitam Mitam Kale Bunjitam Shadrasam. Shadrasayukta Ahara is consumed in proper quantity, keeping in mind appropriate season and digestion capacity. It provides Tushti, Pushti, Dhruti, Buddhi, Paurushya, Bala, Swara, Oja, Teja, Jivana, Pratibha, and Prabha. These are the significance of Pathya Kalpana. Need of Pathya Kalpana. Pathya Kalpana is suggested in various places in Ayurveda. Pathya Kalpana must be used in Dinacharya and Rutucharya. It is very much necessary for the patients to have the food which will keep their dhatus in a healthy state and will not let them get vitiated more from doshas. So the patient must follow the healthy way of consumption of food, that is Pathya. Pathya Kalpana is also used in Panchakarma to boost the fatigue, Annavasrotas and Purushavasrotas to regain the healthy stage from weakened one. According to Acharya Sushruta, Pathya can be divided like Manda, Peya, Yavagu, Vilepi. Manda Kalpana. Nire Chaturdasha Gune Siddhe Mandasva Siktata means this kalpana is prepared by using rice and water in 1:14 proportion. The rice is cooked in said proportion of water, and then only water content of the prepared formulation is collected as manda. By biological properties of manda, it is lagu and shita. Biological action of manda is deepana, pachana, grahi, and vatanulomana. Pharmacological action of manda. Mandastu Deeptyagni Vatam Cha Anulomayet Mrudu Karoti Srotasim Sveda Janayatyapi Langitanam, Viriktanam, Jirne Snehacha, Trushyata, Deepatva Lagutvacha, Mandaha, Syat Pranadharana. According to different references, we can see different types of manda, like Laja Manda explained in Sushruta Samhita, then Ashtaguna Manda explained by Sharangadhara Samhita. Moving on to Peya Kalpana, Peyam Sikta Samanvita. Peya is prepared by boiling 1 part of Ahara Dravya with 14 parts of water in a clean stainless steel vessel over mild fire until all the rice particles are properly cooked. Biological properties of properties Lagu, Pachana, Vatanulomaka, Dhatu Pushtikara. It indicates in Jwara and Atisara. Action of Peya. Peya helpful in relieving Trishna, Glani, Daurbalya, Kukshiroga and Jwara. Different references we can find Peya Kalpana, Yavagu Kalpana. Yavagur Bahusiktatam Syat, Yavagu Shadgune Pachet. It is prepared by boiling 1 pot of tandula with 6 parts of water over mild fire until the rice particles are cooked. It contains more portion of Sitta than Manda. Indication, it can be indicated in before Siravada, in Garbini, Unmada and Mandagni patient, and in Trishna condition. In Ayurveda literature, Yavagu is divided into 3. Kalpa Siddha Yavagu, Gohel prepared with a paste of medicine, and Pata Siddha Yavagu, Gohel prepared in a decoction of the medicine, Mamsarasa Siddha Yavagu, Gohel prepared in a meat soup. These are the different references. Moving on to Vilepi. Vilepi Viraladrava. Vilepi is prepared by boiling 1 part of Ahara Dravya with 4 parts of water in a clean stainless steel vessel over a mild fire until all the rice particles are properly cooked. Only solid portion is considered as Vilepi. Action of Vilepi. It acts as a Vatanulomana, Tirpaka, Grahi, Lagu and Ridhya. Moving on to Annakalpana. Annakalpana derivation, Ad, which means to eat. Synonyms: Bhaktam, Annam, Kuram, Andobirasam, Didivar, Odanam. Bhakta, Anna, Kura, Andha. These are the synonyms of Annakalpana. According to different acharyas, Annakalpana explained like according to Sharangadhara, Jale Chaturdasha Gune Tandulam Chatushpalam Ipache Srayen Mandam Sa Bhakto Maduro Lagu. According to Sushruta, Annam Chaturgudam Toye Bhava Prakasha Sudautam Tandula Sifas Toyim Panchagune Pachet. According to Kaideva Nigantu, Siddham Dashagune Toye Tandurabhyam Parisrutam. Properties of Annakalpana. Odana prepared with properly washed rice will be pleasing with a good odor. The appropriately boiled and suitably prepared rice will be lighter for digestion. Odana prepared with unwashed rice will be non-pleasing with a disagreeable odor. Here the rice particles are inappropriately cooked and will be heavier for digestion. Yusha Kalpana. Alkan Dravyapalam Shunti Pippali Charda Karshika Vari Prasthena Vipache Sa Dravo Yusha Uchyate. Ingredients of Yusha Kalpana: Auchada Dravya Kalka 1 pala, Shunti Churna half pala, Pippali Churna half pala, water 1 prastha. Method of preparation: all the above said ingredients are taken in a clean stainless steel and the vessel is placed over a mild fire and cooked until a thin gruel is obtained. Properties of Yusha Kalpana: Yusho Valyo Lagu Pasho Rucham Kantakapaha. Yusha preparation are useful as Agni Deepaka, Rechaka, Rishya, Varnya and Balakara. Yusha can be divided into 2 types, Kruta Yusha and Akruta Yusha. Kruta Yusha is one where the preparation is subjected to samskarana with sneha and fine powders of selected spices such as Twak, Ela, Tejapatra, Chilli, Saindava, etc. in a suitable quantity. Akruta Yusha means is the one where the preparation is not subjected to samskarana with the sneha or with the fine powders of spices. Krishara or kitta is called as a khichdi in a layman language. To prepare krishara, tandula and shimbidanya are taken in either a 1:1 or 1:1/2 or 1:1/4 ratio as per the need. Little amount of sneha, saindavallavana, ardraka, hingu, aridra are added to the preparation. The mixture is cooked in a vessel with 6 parts of water until all the rice particles are fairly cooked and the preparation attains a solid consistency. Properties of krishara, kapha pittakaraka, balya, and vata shamaka. Coming on to conclusion, Ahara Kalpana makes our food healthy and suitable. It is helpful in both the condition-wise Swasthya and Atura. Ayurveda's approach that the Jataragni of the patient is equally important to that of the properties of Aushadha. It covers all the nutritive values as it provides food having all the 6 tastes. Thus help in maintaining the Panchabautika nature of the body. It also makes the food pleasurable, thus acting over both physical and mental. So Pathya Ahara Kalpana should be incorporated in our daily diet regime to achieve the basic aims of Ayurveda. Thank you.
Thank you, Dr. Nisarga. Next, I invite Dr. Laxman, Chandrahar, Khajekar for the paper presentation on the topic Ayurvedic Management of Rheumatoid Arthritis, Amavata, a case study. Dr. Laxman, are you there?
Yes, sir. Am I
Okay,
audible?
doctor. Audible, doctor. Please share the screen.
Okay, thank you, sir. Good evening, respected teachers. Let me introduce myself. My name is Dr. Laxman Khajekar. I am from Siddhakala Hospital, Sangamner, Department of Kai Chikitsa, third year PG. Today I am going to present Ayurvedic Management of Rheumatoid Arthritis in Amavata case study. Introduction. Rheumatoid arthritis is an autoimmune disease and most common persistent inflammatory disease occurring throughout the world in all ethnic groups with male is to female ratio is 1:3. In India, prevalence rate of rheumatoid arthritis is 0.5 to 0.75%. The peak age of onset is 4th to 5th decade, first time described in Madhav Nidan as separate clinical entity in the 7th century. Characterized by the Angamardha, Aruchi, Trushna, Alasya, Gaurava, Jwar, Apak, Angoshoto, etc. Case study. A 42-year-old female having 58 kg weight with no any comorbidity came with having complaints about malaise, anorexia, thirst, laziness, heaviness, indigestion with multiple joint pain and swelling over the PIP and MCP joints with symmetrical distribution along with the morning stiffness of more than 2 hours, which is characteristic features of rheumatoid arthritis. Surgical history of tubectomy before 15 years. On examination, general condition was moderate, temperature was 98 Fahrenheit, pallor was present, BP 130 to 70 mm of Hg, pulse 78 per minute. Respiration rate was 20 per minute. Routine hematological investigation, HB 7.9 gram%. Patient was diagnosed on the basis of Lakshan of Amvat and confirmed by ESR, erythrocyte sedimentation rate and rheumatoid arthritis factor was positive. Systematic examination, RS, AB clear, cardiovascular system, S1, S2 normal, CNS conscious and oriented. Ashtavid parikshan of the patient, Nadi, Vat Pradhan Pitta, 78 per minute, Mala Asamyak, Mutra Samyak, Jiva Ishat Sam, Shabda Spashta, Sparsha Prakrut, Druka Prakrut, Akruti Madhyam. Criteria for to know the severity of the rheumatoid arthritis. Joint affected first, 1 large joint, 0 score, 2 to 10 large joint, 1 score, 3 to 3 small joint, 2 score, 4 to 10 small joint, 3 score, less than 10 joint, 5 score. Serology. Negative rheumatoid factor and ACPA 0 score, low positive RF and ACPA 2 score, high positive RF and or ACPA 3 score. Duration of the symptoms less than 6 weeks 0 scores, more than 6 weeks 1. Acute phase reactant. Normal CRP and ESR 0 score, abnormal CRP and ESR, ERS 1 score. Treatment. Ruksha sweat, that is dry fermentation with Valuka potli, Erandatel for therapeutic purgation, Sendavadi Vati. Anuvasan Basti along with Shaman Chikitsa was planned. Valuka sweat, Erandatel, Sendavadi Vati Basti were started from the second day of admission and continued for the 16 days. Baluka sweat sand is used for dry fermentation. 30 ml of Erandatel was given with 1 glass of lukewarm milk at bedtime. Anuvasam Basti with 60 ml Sendavadi Tel was administered once daily after a meal in the morning. Shaman Chikitsa. Sianath Gugul 2 tablet 5 mg twice a day. Trifaya Gugul 2 tablet 5 mg twice a day for Sandishul and Sandishot, and Panchakol fan twice a day given for Dipan Pachan. Veshwarna Churna 8 gram with lukewarm water given at bedtime as for Vatanuloman. Assessment before and after the treatment. The pain. Before it was severe, then mild, swelling present, then now absent. Morning stiffness up to 2 hours, now up to 10 to 15 minutes. Appetite poor, now improve. Sleep disturbed, now adequate. RA factor, high positive, greater than 60 IU per ml. Now low positive, 40 IU per ml. CRP was more than 5.0 magnesium per hour, now 4.0 magnesium per liter. ESR 32 mm per hour, now 28 per mm per hour. Criteria score was 10:10, now it is 4 out of 10. Discussion. Valuka Swedan removes the blocks created by kapha, ama, and relieves pain, swelling, and stiffness. Erandatel is utilized for Shodhan, elevates vata, kapha, and stimulate the agni. Sendavari tail has Dipan Pachan Dravya Vat Kapha properties. In Amavata, Vat Kapha are two main pathological factors that get subsided by this dravya. Conclusion. As per result obtained in this case, it is evident that Dipan Pachan, Valuka Swed along with the Sendavari tail Anuvasam Basti shows remarkable symptomatic relief in the features of Amavata. At the end of the management, 50% improvement was observed in the overall effect therapy. Based on this case, it can be concluded that Ayurvedic treatment protocol of Amavata can be effectively managed in the early stage of disease. Thank you.
Thank you, Dr. Laxman. Okay, next I invite Dr. Prasad Yewale for the paper and poster presentation. Dr. Prasad Yewale. Hello, Dr. Prasad Yewale.
Yes, sir. Yes, sir. I am
Okay,
present.
doctor.
Myself, Dr. Prasad Yewale, and my topic for presentation is necessity of Rasayana in children of present era. Comorbidity is the branch of Ayurveda which deals with the disease, providing care, proper nutrition, and promoting proper growth and development of children. Children are delicate, hence they are more prone to diseases which may affect their growth and development and academic growth. In the present era, recurrent infectious diseases are the main factors affecting children through many vaccines are invented, but they are not sufficient to prevent each and every disease, and hence improving one's immunity is must to prevent child from recurrent infection. Aims and objective of this study is to study the necessity of use of Rasayan drugs in the children of present era, and objective of this study is to study the Rasayana and to study in brief about the immunity. Immunity according to Ayurveda is known as Vedic Shamatva. It is nothing but the capacity of the body to fight against the disease. Nidan, dosha, and dhatus determine bodily immunity or susceptibility for the disease. Causes of recurrent infection in the children are sukumaratva, alpakayata, aparipakva dhatu, asampurna balak, क्लेश सहिष्णुत्वम, अनियताग्नि, असमत्वगत प्राण, दोष धातु मल अल्पत्वम. Action of the Rasayana, effect of Rasa Dhatu. Rasayana improves proper nutrition of the Rasa Dhatu, which leads to production of good quality of other Dhatu, resulting in increase in Bala or the Vedic Shamatva. It is also helps in improving agni, that is digestive power of the body, which is responsible for the good that production, ultimately improves the Dehbala. Infectious diseases are the main cause of morbidity and mortality in the children, which affect the growth of children, resulting in malnutrition and developmental delay. As explained earlier, Vedic Shamatva is directly related to the proper nourishment of the dhatu, and Rasayan drugs act at the macrocellular level and provide proper nutrition, which results in production of good quality of dhatu, which will increase the immunity. Immunity helps in in the children for the Rasayana purpose. And Rasayana helps in promoting the physiology, promoting the against the disease both physically. Rasayana helps in promoting the physiology, producing resistance against the disease both physically and mentally. In Balyavastha dhatu are in Aparipakva Avastha, which may prone them to various diseases. By using appropriate Rasayana drugs, one can prevent children from the recurrent infection and malnutrition, etc. Rasayana therapy helps in proper growth and development of a child. Role of pediatrician is not only to treat the disease, but to prevent the children uh, from the secondary infections. Hence, it is necessary to use Rasayana drugs in the children for their proper growth and development along with the prevention of diseases. Thank you, sir.
Thank you, doctor. Next is the poster presentation.
Title of my poster presentation is Effect of Yoga in Gadget Addicts in the Gadget Addicted Children. Introduction and need of work. Addiction may be defined as a process whereby a behavior that can produce pleasure and a relieve internal discomfort is employed in a pattern characterized by a recurrent failure to control the behavior, that is powerlessness, and continuation of the behavior despite significant negative consequences. It hampers children's physical and mental health. Eye irritation, headache, and finger pain, obesity are the common with it. Social isolation, impaired social skills, poor academic performance, uh, def- attention deficit hyperactivity disorder, depression, and the suicidal ideation have been reported to the associated. Acharya Patanjali defines yoga as the yoga chittavritti nirodha, that is the method to control over mind and thinking the process. Aim to study the effect of yoga and gadget addiction in the children. An objective of the study is to study the effect of yoga on body and to study the effect of yoga on mind. Materials and methods. The relevant literature related to this topic is reviewed through various Samhita, index journals, and the internet. The results are Acharya Patanjali defines yoga as a yoga chittavritti nirodha, that is the method to control over the mind and thinking process. It is having total eight steps as follows: yam, niyam, asana, pranayam, pratyahar, dharana, and the samadhi. Conclusion is yoga has the power to cleanses your mind, soul, and body while also managing our emotions. This phenomenon is helpful in reducing relapse risk and craving for the addictive substances, depression, and the stress. Mental stress are frequent variables that set up addictive behavior. Thank you, sir.
Thank you, Dr. Prasad. Next, I invite Dr. Vashishth Gohel for the paper presentation. Dr. Vashishth, are you there? Dr. Vashishth Gohel, are you there? Okay, next I invite Dr. Ananya Agrahari for the paper presentation. Dr. Ananya.
Yes, sir. Today, I'm going to present on poster presentation. Myself, Dr. Ananya Agrahari here. I am starting with my poster presentation. That is, you can see in the screen which is being shared, a case record of Ayurvedic management of oligoasthenospermia. I have here we have treated a patient who was having oligoasthenospermia. Here is the introduction. Can you change the slide to introduction, sir? Yeah. So as you can see, the incidence in the male infertility is on the rise in today's scenario. There is a decreased motility and abnormal form of the sperm. We hear, and even the decreased sperm count being observed in the patient's report very frequently. It is estimated that around 48 million couples are infertile in the country, which is a very high ratio if you see, and 50% cases are related with male infertility, where the male partner is being involved. Here, the case which I am presenting is that the patient having oligoasthenospermia. So, can you share, sir, aim please? Yeah, here I will try to improve the quantity and quality of semen by Ayurvedic management. In further, I will let you know what are the trends and how the report is being changed. What I have done and what is being changed there with what types of drug I have used. So here I will present with you a case. A case was there where a 30 years old male with his and his wife, 26-year female, was presented with a possible fertility problem. They were married for 2.5 years, whereas female companion don't have any history of irregular menstruation, any anatomical or hormonal parameter was within normal limit. There was no history of consanguinity and no abnormality as yet, but the patient has some complaint of dyspareunia sometimes. The couple, earlier they used to have barrier contraceptive, which they have done it for 1 year, and they are married for 2.5 years. But since 1.5 years, they were trying without any contraception, but there was a failure in the conceivement. So we have advised the lady to do the follicular study, which was in normal limit. Both the partners' vital was in normal limit. We have advised the male partner to do the semen analysis. I will share the report as further. Here the treatment, I will like to come on the treatment, what I have given, and then I will show you the analysis of the results. The treatment for the female prescription, I have given them tablet Foliact N, OD for 30 days, and tablet Pushpa Dhanvaras was given BD for 30 days. It was only for 30 days I have given for 1 month. And for the male prescription, I have used Safed Mushlika Churna. That was 100 gram Bringraj. As you can see, the parameter I have written, Bringraj Churna 40 grams, Gokshur Churna 30 grams, Trivanga Bhasma, that was 5 grams, Kapikachu Churna was 60 grams. So I have prepared a kadha out of this, and we have prescribed them for 1 teaspoon BD daily with Khadi Shakar, Adho Bhakt. That is after meals. Can you change the slide, please? Yeah. After the 2 months of complete treatment, which was given to the patient, he was visited again with the semen analysis report. As you can see, the male partner, before the treatment, the pH was 7.6, which is normal, but it is raised. Total sperm count was very less. It was 64, in which the dead sperms was more, and motility, active motile was very less. Sluggishly motile, you can see that it was 30%. But after the treatment of 2 months complete to the male, this was the following report. You can see that is being presented here. That was 7.4 was the pH and 152 millions count. This was done in only 2 months period. It was not like it was taken 3 months, 6 months. No, with the active life modifications and main treatment, the patients, these are the following results which you can see. So there was the active motility of the sperm, which is increased from 40 to 86%, and the dead sperm has decreased from 50, which was more than 50. Now it has less than 24. And after the complete treatment, the patient was visiting and following with us for 8 months. 2 months of the treatment for the male, and with the prior preconceptional counseling was done. So accordingly, the female partner, when we done after the 8 months period, when she was not having any menstrual resistance for 2 months, we checked it. The UPT came positive earlier, and the USG was suggestive of a single life intrauterine pregnancy of 8 weeks gestation, with the fetal cardiac activity was present. So I would like to tell you about the discussion and the conclusion. Lastly, the male infertility refers, what it is exactly. Male infertility is that it is an inability of the male to cause pregnancy in a fertile female. Some of the possible responsible factors of infertility, this is from the male point of view, like poor semen quality or quantity, which I have already discussed in the introductions. Genital factors may be there, testicular function may be the problem, impair endocrine interrelationship, etc. This might be the problem. Sometimes there is a physical damage, sometimes there is a trauma, and all these things can lead to decrease sperm quality and quantity. Okay, and there are many drugs in the Ayurvedic text, where many aphrodisiac drugs has been given in the Ayurvedic text, which is not only effective, but it can be easily be available for the common people also. So here I have presented a case which I have used Ayurvedic medicine for the management, and you can see the results. Thank you all for hearing this. I hope you try this in your practice as well. It will really help you a lot. Thank you.
Thank you, Dr. Ananya. Next is the paper presentation.
Yeah, sir. Here, as you can see, this is the paper presentation topic. Here we have treated Sthanyakshaya with Daruharidradigana Kashaya. The special reference was taken from as hypogalacturia. This is a single case study. Here we have taken the reference of Acharya Govinda Sen, who has described Daruharidradigana Kashaya, which has the following content. I will describe that further, like Daru, Haridra, Indrajav, Yasti, Madhu, and Prushni Panni. The introduction for this is, I would like to tell you all, we think Stanyakshaya is not such a big problem, but if you see, as per Ayurveda, the female is a foundation for reproduction and even responsible for Kav, Dharan, Poshan, and Apathya, Janam, and Sanjopan. The incidence rate, which is 23% to 63% during the first 4 months after the delivery, mainly in the primiparous woman, you can see all these things. Here, it is very much crucial for a baby to have 4 to 6 months of the life for the nourishment by the breast milk. If there is inadequate lactation, the baby has mental issues and many times physical issues as well. If there is an adequate lactation, the adequate lactation means what? It is actually the secretion of 300 ml by the 5th day and 480 ml by the 10th day. And how we know it, if it is sufficient or not? If the baby is satisfied and is sleeping for 3 hours after the breastfeeding and passing urine at least for 6 to 8 hours in 24 hours and gaining weight, so we can understand the mother is producing enough milk. If any of this criteria differs, we can say there is lactational deficiency, that is, there is a Stanyakshaya. So here I have taken the reference. Sir, please, sir, you can change the slide, sir. No issue. Many of the acharyas of ours has given about the different method where we can treat Stanyakshaya. Here I have taken Govinda Sen the reference. What is Stanyakshaya? It is actually the decrease in quantity of the stanya, which is due to Ras Dhatu Shaya or Dhatu Dusti, ultimately because of the Dhatu Agni Mandya. The incidence rate I have already told you. After it is in the first 4 months after the delivery, it is 23 to 63%, which has been noted like 40% in the clinical practice in India. Acharya Govinda Sen has told about Daruharidradigana in Stan Vriddhi, that is given in the Stana Roga Chikitsa Adhyaya of Bhaishajya Ratnavali, which is advised for Stana Shodhana. Here we have tried it for Stana Vardhana. How it works? I will conclude all these points in the conclusion, but for a short intimation for what it actually helps is, it helps in clearing the Shrotoshanga, which I have used as a prescription, where by increasing the Jat Ragini, and if the Jat Ragini increases, the Rasa Dhatu Agni automatically increases, which turns and helps with the Ras Dhatu and Up Dhatu Nirman and Poshan. This is where the Mandagni is the main reason, because after the delivery, the female there is Agni Mandyata. So here we are treating her with it by Deepana Pachana Karma, by which she is getting helped with the milk ejection and frequencies as well. So the disease I have taken from the Sannyasha definition from the Shushru. Here the three main points was given by the Shushrut is Stan Mlanta, that is flaccidity of the breast, and Stannes Abhav Alpata, that is quantity of the breast milk. The Shushrut has given Spleshna Vardhan Dravya Upyogaha. I have used Govinda Sen. Sir, can you change the slide, please? Sir, change the slide, please. Yeah, thank you. Here, what I was discussing earlier is the Daruharidradigana Kashaya's content. It has mainly 5 ingredients. It is Daruharidra, Dharidra, Indraja, Yasti Madhu, and Prishnipadu. I will tell you in the discussion how it all works. Here you have to see mainly the Rasa and the Guna, what and the Virya, which it is already having. As you can see, Daru, Haridra, Haridra, Indraja, Yasti Madhu, Prishnipadu, everything has been given in the table. Here I will discuss the direct point in the discussion, so you will get to know how it actually been working. Here I will start with a case presentation. Then I will tell you how and what we have treated. So can you change the slide? Here she is a patient of around 21 years, female, resident of Khargaon. She was presented, 25 years female, she was presented with the following complaints. She was complained with the Stanyakshaya. That is, she told Stanya Pravrutti Abhav. Stanya was not coming enough, and Stanya Mlanta was there. She told that there was a very laxity of the breast. She told me. I have written that. And she has no history of past complaint. Nothing was as present. Family history was also quite normal. Vitals parameter was okay. Systemic examination was also okay. She was married for 2 years. Her LMP last was in 11 months. She used to have previous menstrual cycle was irregular. And objective history, as you can see, she was G1 P1, delivered full-term normal delivery with episiotomy. The male boy was of 15 days to 2.4 kg weight. So what was the main examination I have done is, I have checked the per abdomen, she was short, per vaginum she was having lochia alba. Breast examination I have done, which was been presented as Alp Stanya Pradurba was there. And there was laxity of the breast, which was present 2+. Their dry and conscious skin was there. Breast engorgement can be seen. That was also severe. And she used to have 0 to 2 times she used to feed her baby. Again, after I have given her Daruharidradi. The treatment regimen given was Daruharidradigana Kasha 50 ml BD. Adho Bhakta, she used to take it. And after the subsequent visit, which was done every 10th day, this was the assessment criteria which is being shown in the figure, which was shown here. This was the material methods. Stanya Mlanta and Stanya Praman. The gradation was given as you can see, it is from Stanya Mlanta. You can see the gradation of 0 to 3. And Stanne Pramane, you can see the gradation of 0 to 2. And breastfeeding frequency was 0 to 3. The gradation you can see how I have graded, right? Breastfeeding frequency is feeding less than 9, feeding more than 9 times a day, or grade 1 is feeding 6 to 8 times per day. As I don't have such time, so I'm not telling you all everything. I have written and presented everything here. I will be very quick. Grade 2, you can see. Sir, can you change the slide? I have already told this. So they can get to know what I am at what point I am. And breastfeeding frequency, as I have already discussed, from the gradation 0 to 2. The grade 3 is like feeding 0 to 2 times per day. When the patient visited me first time, this was her grade. Breastfeeding frequency was 0 to 2 times. And the examination I have already told you. And the breast enlargement, I have given the gradation from 0 to 4, which is normal, mild, moderate, severe, and very severe in grade 4. The lady which was presented was in grade 3. And milk ejection, gradation is given from 0 to 3. So 0 is very forceful and 1 is streamline. Grade 2 was drop by drop. And grade 3, no milk. She was in grade 2 of this, which she was having drop by drop. I have given her the treatment regimen as Daruharidradigana, which is having 5 content, 50 ml BD, and was given Adobhakt after the meals with a duration of 40 days. Where she has to visit me every subsequent visit was done every 10th day. Every 10th day she used to visit. There is a further chart will be described, which describes you the parameter which is being changed from start to end. I will show you that at the very end. But I will tell you the patient used to visit every 10th day. The first visit was she was done on 9/5, and after that she has done on 18th May. After when she has done, the last visit was done by her was in 17th of June. That was totally 40 days. And at the very end stage, last stage, there was no issues with the milk ejection frequency, feeding, engorgement. There was no there is no mlanta, and the praman was also increased. So I will go on the results and discussion. No, sir. Can you show the slide of result and discussion? Back, sir. Yes, sir. Thank you, sir. The patient was earlier, she used to come, and after the first week, she has visited me. And after that, there was subsequent visit on every 10th day for 40 days, which was being done. So the parameter which I have already shown you was increased, like breast engorgement, milk ejections, and feeding patterns. Significant improvement was present. And this treatment was continued for 40 days. So by this, I can conclude that the 5 ingredients that was Daruharidradi, Haridra, Indraya, Krishnapandi, and Yashti Madhu Kashaya was given as per the instruction of Kashaya Kalpana Adhyay, which is given by Sharangar, and advised for after Adhobhakt, Ausha Sevan Kal. As in Adhobhakt, if the patient is taking any treatment, Adhobhakt is the result for Brihan, Rasayana, and Palya Aushadhi is mostly given in Adhobhakt. Here what happened is I was correcting the Agni. So by correcting and strengthening the Vyanvat, correction of the Vyanvat, so there was a proper separation of the nutrients and waste product by occurs, due to which. So by that the Uttara Dhatu Poshan and Upadhatu Nirman was regularized. By using this combination, the Agni Mandya was decreased. So you can change the slide. Yes. After that, in the second para, the Agni Mandya was decreased and doing the Shruto Shodhan work, because the majority of the drugs was in the chart which I have shown you was Lagu in Vipak and Ushna Virya. So they were, when they were used, so the Samprapti Vighatan, it occurs, the Samprati Vigatan was done that provides prenan and poshan to Ras Dhatu Agni Mandhyata and Radha Ras Dhatu Shaya, which was the main common factor of Stanya Shaya. And same was characterized because of what the Stanya Pramana was increased by whereas the Stanya Praman was included as Stanya is the Upadhatu of Rasa Dhatu. Okay, by that it was increased. And here the Yashtumadhi and Krishnapandi was in Madhur Vipak. Ushna Virya and Katu Vipak. So it will work for the Am Pachan and Agni Vardhana. Shruto Shodhan was done and Vata Anuloman. Yeah. So by that the Jat Ragini was treated, which ultimately increased the Rasa Dhatu Agni Vardhana. Rasa Dhatu Agni was Vardhana, and it helps in the Rasa Dhatu and Upadhartu Nirman and Poshan. Even it is Medhya Rasayana as well, having Sheet Virya and Madhur Rasa and Madhur Vipak. So Ushna Virya and Katu Vipak may have helped them in the hormone stimulating action. So that because of what that attributes similar to the Stanya, so the Stanya Praman is increased. And even helped in the Rasa and Stanya Vruddhi. Here the what mainly happened, there are many galactogogues present in the market with Madhur Rasa Pradhana and Bruhana in a nature. But here I have used Govindas Sen, Govindas Sen, Daruharidradigana Kashaya, which was Deepak and Pachan Karma, was done. And by increasing the Dhatu Agni Mande and giving, and this is mainly also used for the strengthening. It is used for strengthening and regaining the body strength and milk production. It works both ways. So the effect was done only in a single patient trial, but it can be extended in multiple clinical trials. So get the proper results of it. Yeah, this is the next slide, please. I would like to tell you the Samprapti and the Ghatak may be different, and different treatment regimen may be required. But this Daruharidradigana Kashaya and Stanyashaya need to be researched on a little better scale, so we can get to know the more effects and the side effects or any other which may not be known. We can get to know it. And the conclusion says, so the conclusion which I include is that it is effective to increase the Stanya Praman. The other chief complaints of the patient was improved, like Stanya Mlanta, Praman, feeding, injection and enzorsement was been better. And it was safe in during the lactation period by the Stanya Vardhak Dravyas. It helps to enhance the milk production in a safer way and regain the body strength in Sutika Avastha, and even provide strength to the Sutika. If you see where we have many Sutika Paricharya we are already having, which states ki what actually happens to the body when a patient delivers. So it is very much required for her to have the body strength. If there will be if the Jat Ragni is increased, leading to the Dhatu Agni Vardhana, so it will ultimately increase in the health of the female. And by that, it will help her to increase in the milk and provide lactation to her baby for the nourishment further. Okay. Thank you so much. And there is no adverse effect of this during the course of study. This is a table which is being shown in the figure. This was the treatment regimen. As you can see, everything is written here. In breast appearance, flaccidity in the parameter which I have taken, I would like to explain this with the concepts of what happened, what was the breast examination every time she used to visit, and what has happened at the end. So as I have already told you the very first one, so second one I would like to tell you. So these are the parameters which is been seen, and at day 40 she was very much satisfied. And thank you for listening very patiently. And if anybody has any questions, you can eagerly ask me. I would try to solve every questions given by yours. Thank you. If there is any questions, you can ask.
Thank you, Dr. Ananya. Thank you
Yes,
for
sir.
the session.
Yes, sir. Thank you so much. Anybody has any question can ask.
I think no more doubt, Dr. Ananya.
Thank you, everybody. Thank you. All.
Thank you, Doctor.
Thank you, sir. Thank you for
We
the
go to
opportunity.
the next presentation. Next, I would like to invite Dr. Shubham Balbhadra for the paper presentation on the topic concept of Marana. Dr. Shubham Balbhadra.
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
Yes, sir. So, good evening, everyone. My name is Dr. Shubham Balbhadra from third year PG Scholar, Department of RSBK from Ramakrishna Ayurvedic Medical College, Bangalore. So today my topic is on concept of Marana. So we'll start with Nirukti of Marana. It is from Mri, to kill or to die. Mariyati means to act of killing, and Marana was the process of killing. Next, we will come to historical background of the Marana. During Vedic period, evidence of therapeutic use of metals and is explained. And Ayurveda have also mentioned the use of Swarna for internal use. During Samhita period, Marana process is also considered under the use of Ayaskriti. Some of the authors used to name it as the use of Ayaskriti as the same process as explained in the Marana. Charka has mentioned use of Tamra Churna in case of Garavisha for Hridaya Vishodhana. Use of Swarna Churna will give instant result according to some authors. During the 7th to 14th century, Rasarnava has described Marna of different metals and minerals and various equipments like Musha and Putta with the help of various equipments like Musha and Putta. And then we will come to definition. Definition of Marna is Shodhitan Loha Dhatvadi Vimardam Swarasadibi Agni Samyogato Bhasmi Karna Maranam Mismritam. Marna is the process in which the purified metals and minerals are converted into bhasma, subjecting them into levitation and incineration. Levitation means bhavana with some other of drugs, and incineration. Marna is the process by which raw materials like metals, minerals, and other ratnas like gems, etc., are converted into microfine, tasteless, and non-hazardous substances which can be absorbable, which can be converted into absorbable form, and which can be used for the medicine and therapeutical purpose. Synonym of Marana is Avasana, that is death, and Alamba, then Nirharata, and Parivarjana, Ujjassana, and Unmadana, throwing off or killing. Objectives of the Marana. It is used for the reduction, it can help in reduction in particle size and transformation into this suitable compound form, and to make the material non-irritant for the GI tract. And it is used for Marana is done to increase the potency and quality of the drug, and for the conversion of unabsorbable materials into the absorbable form, and so that it can be used as the assimilable form into the body, and to make the material suitable for therapeutic usage. Types of Marana is explained according to Rasaratna Samuchaya. There are 4 types of Marana they have explained by our acharyas. One is Shrestha, Madhyama, Kanishta, and Durgunaprada. Shrestha prepared with Rasa Bhasma, and Madhyama means Marana of the substances which is prepared with cast aushadis, and Kanishta is prepared with Gandhaka, and Durgunaprada is prepared with Arilohas. We will come to methods of Marana. Marana procedure can be carried out by 2 methods, that is Agni Paki method and Bhanu Paki method. In Agni Paki method, we will use 2 different heating devices are to be used for incineration process, that is Puttapaka and Kupi Pakwa method. Puttapaka method is mainly done for Loha Marana, Abraka Marana, and Kupi Pakwa is done for Swarna Marana, Parda Marana, Somnathi, Tamra Bhasma, etc. Bhanu Paki method, first kajali will be prepared, and then bhavana with particular liquid metals for certain period will be given, and after that Chakrikas has to be made in Gohel. and then it is kept in the bronze sharava, and after that covered with specific leaves, subjected to sunlight for complete dryness, and after make sharava samputa, put put this sharava samputa into the dhanya rashi for a specific time period and collect and make it into the powder. Example, for mainly it is done for loha marana, Banupaki method. Then procedure of marana, it is mainly divided into three parts: Purva Karma, Pradhan Karma, and Paschat Karma. Purva Karma is collection of the Grahya drugs, and then we have to do Shodhana, then Bhavana, then Chakri Karna of the drugs, and then Samputi Karna. After that, Shodhana. So in this collection of the Grahya drugs has to be done based on the method of the collection told in the classics. After the Shodhana Udrishta Ausade Sandram, Kriyate Peshanadikam, Malavichilyate Yaktu, Shodhanam Tadi Uchate. It is told according to Rasatarangani, when the substance is subjected to trituration with specified plants or animal resources with the help of patiently so as to remove impurities, it is called as Shodhana. Then Bhavana, Yachurnitas Dhatvade, Dravya Sampesha Shoshanam, Bhavanam Tanmanam Vigye, Bhavanam Tan Iksha Nigadyate. A liquid is added to the powder and is triturated till all the liquid portion is absorbed. This procedure is known as Bhavana. And importance of Bhavana is a less potent drug can be converted into more potent drug with the help of Bhavana, and particle size becomes smaller after each Bhavana, and Shodhita materials and Bhavana dravyas come in close contact to make a homogeneous mixture, and also it acts as a binding material for the preparation of the Chakrika stage. And then Chakri Karna and Golaka, they are some of the same names. And objectives of Chakri Karna is it facilitates drying process so that the duration will be less, and it can adjust higher amount of material in a limited space of sharavas, and helps to spread homogeneous heat to each particle of the drug, and then enhance the surface area of material to allow maximum heat transfer during the puta. Then Samputi Karna. Samputi Karna, it can be done in two types. That is Sharava Samputi Karna and Samputi Karna with the help of the Erand Patra. And it should be inert, not so thick or thin, and it should be heat stable, and it should be good conductor of heat. Otherwise, everything will be burn out. And objectives to apply the uniform, and it is used for the application of uniform and standard heat. Then Pradhana Karma. Here Putpaka is given with the help of Vanodpadas like powder cakes. Depending upon the nature of the drug, different types of Puttapakas are mentioned in the classics. If it is a hard drug, then we have to do Mahaputta, or if it is medium type of drug or hardness is not that much, then we can go with Kukutta Putta, etc. Different types of Puttas: Mahaputta, Gajaputta, Varahaputta, Kukutta Putta, and Kapota Putta. Okay. Then Paschat Karma. This is the final step of Marana process. This step can be divided into two types. They are trituration of pellets. After the Swangashita, the drug is collected and then it is triturated. And after that, the powder is administered into the Bhasma Pariksha. This is Paschat Karma. And after that, we will go to Bhasma Pariksha. That is, Bhasma Pariksha is like Sukshmatva, Mridutva, and Slakshnatva, and Varitaratva, Rekha Purnatva. Rekha Purnatva, Sukshmatva means it should be very fine powder, and Mridutva means it should be, like drug should be Mridu. Slakshnatva and Varitaratva. Rekha Purnatva means it should fill in the fingerprints of our fingers, minute pores of the fingers. Nischandatva, Nirdhumatva. When it is kept into the fire, it should not produce any fumes. Uttama and Gatrasatva and Niruttatva, Apunarbhava and Vashishth Varnotpatti. Vashishth Varnotpatti. These are the Bhasma Pariksha for the particular. Every Bhasma Pariksha, after the administration of Marna, every Bhasma has to undergo Bhasma Pariksha before it is used for the patients. That's it. Thank you for listening. If anyone is having any doubt, they can please tell me. Hello.
Thank you, Dr. Shubham.
Thank you, sir.
Next, I invite Dr. Dimple Ashok Burija for the paper and poster presentation. Dr. Dimple Ashok Burija, are you there?
Yes, I am there. Allow me for screen sharing.
Please share the screen, doctor. Now, please share, doctor.
Yeah. Am I audible to everyone? Good evening to
Dr.
one
Audible.
and all. Good evening to one and all. Myself, Dr. Dimple Ashok Boricha. I am an MS PG scholar, third year Shalya Tantra Department from Yashwant Ayurveda College, Kolhapur. My title for today is Arsh Vyadhi and its Chikitsa Upkaram. The disease that is troubling the human being since the time immemorial is Arsh, because of its manifestation at the Gudabhag, Mool of the Sharir. The Chirkari Vyadhi, because of the Mounts Pradoshana, present with the Pratyatma Lakshan of Ankura at the Gudbhag. When it becomes visible, this fetches the attention of the patient and troubles them with the range of interfering in their daily routine. Arsh Vyadhi. Arsh are very common problem in our modern lifestyle. Hemorrhoids are swollen inflamed veins and capillaries around the rectum. In these days, many people want to know how to manage piles naturally, easily, and fast. Here, in this article, we will know the causes that why the disease is so common in our day-to-day life and how to manage the disease with minimal interventional procedures such as Kshar Sutra ligation, Kshar Karma, Agni Karma. Causes of Arsh. Hemorrhoids are often described as the varicose veins of the anus and rectums. The exact cause of the hemorrhoids are still unknown, but still there are a number of factors that may contribute to the disease, such as low fiber diet, constipation, junk food, lack of exercise, long straining during defecation, and during childbirth, the intra-abdominal pressure can also cause piles. Now, the Ayurvedic classification of Arsh. There are 6 types of Arsh in our Ayurvedic text, such as Vataj Arsh, Pittaj Arsh, Kafaj Arsh, Sanipattaj Arsh, Sahaj Arsh, and Raktaj Arsh. According to the modern classification of piles, on the basis of position, the piles are classified into 3 types, that is, internal piles, external piles, interno-external piles. On the basis of symptoms, piles are classified into 4 categories. Grade 1 piles, no prolapse, only prominent blood vessels are seen. Grade 2 piles, prolapse upon bearing down but spontaneously reduces. Grade 3, prolapse upon bearing down and require manual reduction. Grade 4, prolapse and cannot be even manually reduced. Now, sign and symptoms of Arsh. Vishtamba, fullness of abdomen, bulging tissue from the rectum, Guda Parikartan, that is pain at the anal region while defecation, burning sensation at the anal region, blood in stool, Amalika, that is sore eruptions. The signs of internal hemorrhoids are there is no pain, only PR bleeding is a major symptom. The symptoms such as mucus discharge, perianal mass prolapse through the anus region, itching at the anal region. The symptoms of external hemorrhoids. External hemorrhoids are the protrusion of the tissues outside the rectum. They are not painful. However, when thrombosed, they may be very painful. Interno-external hemorrhoids are the mixed symptoms of internal and external piles. Now, we'll go on the conservative management of piles. The management of piles depend upon the degree of piles, that is 1st degree, 2nd degree, 3rd degree, and 4th degree. In the 1st and 2nd degree piles, various Ayurvedic preparations are available to cure the disease. The main preparations are Deepan Pachan Aushadhi, for example, that is Chitrakadi Vati, Lavan Bhaskar Churna, Agni Tundi Vati. For prevention of constipation, we have Trifala Churna, Panchaskar Churna, Haritaki Churna. For Arshogna Aushadhi, we have Arshakutha Ras, Shigru Gugul. For Sits Bath, we have Triphala Quat. Rakt Stambhak Aushadhi, we have Bol Parpati, Kunkutwak Twak Bhasma, and Praval Pishti. For Vrand Ropak, we have Jatyadi Tel and Nirgundi Tel, and Vedna Har, we have Matsyadi Tel and Triphala Gugul. Apart from the conservative treatment, various procedures like electrocautery, infrared coagulator are also used to cure disease. But they all are the modified form of Agni Karma, which was described by Acharya Shushrut decades ago. In the 3rd and 4th degree piles, the following Ayurvedic treatments are available. Kshar Sutra ligation. This is a very effective procedure for hemorrhoids in which the medicated herbal coated thread is ligated on the external and internal pile mass, and after 5 to 7 days, this pile mass falls off. The next is Kshar Karma. Kshar Karma is a procedure in which the Kshar is applied on the pile mass and then the pile mass is washed off with the lemon water. The sclerosing agent like Apamarg Kshar and Xnui Kshar is used to do this procedure. The next is Agni Karma. This procedure can be done with the electrocautery, infrared radiation, laser cryosurgery is done. The next is Chedan Karma. This is used if the conservative treatment fails or it doesn't respond. There are a number of surgical excision techniques which are used for piles. All are associated with some degrees of complications such as infection, bleeding, fecal incontinence. Benefits of Kshar Sutra. Kshar Sutra is a daycare surgery, does not need an admission, useful in all ages, even in the cardiac patients. Simple procedures, safe and sure treatment. No reoccurrence, no complication, very high success rate. Not very costly and no antibiotics are required. Pathya, Apathya in the management of piles. Pathya, non-suppression of natural urges, very important. Green vegetables, low-fat diet, milk, butter, ghee, wheat, rice, regular sleep and diet. Apathya, chilies, fried rice, junk food, maida products, non-veg, constipating food, sedentary lifestyle, excessive pressure during defecation can cause ursh. Conclusion. Ayurveda has every procedure for pile management, conservative as well as surgical patient. The patient should not hesitate to share the problem with the Ayurvedic physician and not prolong the problem. Kshar Sutra ligation is the most effective treatment of piles that takes less time. It can be performed in those patients which mainly suffer from cardiac diseases and also does not require any admission, and it is economical too. So, Kshar Sutra is much more beneficial in comparison to hemorrhoidectomy. Thank you.
Thank you, doctor.
Now I'll be presenting my poster.
Okay, doctor. Please present your poster.
Am I visible to all?
Yes, doctor.
Yes. Okay. So my title for poster presentation is Role of Agni Karma in the Management of Various Diseases. Ayurveda is an ancient science of healing diseases. In Ayurvedic treatment, Acharya Shushrut has mentioned different methods of management of diseases such as Beshaj Karma, Kshar Karma, Agni Karma, Shastra Karma, and Rakta Moksha. Today, in my poster, I would like to explain about Agni Karma. Agni Karma means application of Agni directly or indirectly with the help of different material to relieve the patient from disease. Agni Karma means the treatment with the help of Agni. Shushrut indicates Agni Karma in various disorders of skin, muscles, vessels, ligament, joints, and bone. In Agni Karma means the application of heat directly or indirectly with the help of different materials to relieve the patient from the diseases. Agni Karma is one among the parasurgical procedure of the ancient time. Agni Karma is used to treat various surgical and non-surgical diseases such as Arsha, Arbut, Bagandar, Sira, Snayu, Asti, Sandigatvat, and Grudrasi. In Arsh, Agni Karma is applied with the red hot shalaka, and the Arsh is burned up to the extent of Mount Dahan. This will help to remove the Sushka Arsh and will not allow them to reoccur again and again. In Arbut, Agni Karma is applied with the help of red hot shalaka up to the extent of Mount Dahan, and gradually the size of the Arbut decreases. Next is Bagandar. In Bagandar, the pidikas occurring in the anal region should be burned using the shalaka. The burn caused due to Agni Karma shall be later on treated on the lines of the burn wounds. Next is Asti Sandigatvat. In Asti Sandigatvat, Agni Karma is performed with the red hot shalaka, and Samyak Twakdagda Vran are created at the maximum tender site of Asti, and significant relief in the pain is observed. In Grudrasi, the Agni Karma is caused by aggravated Vad dosh. Agni Karma helps to reduce the effect of Vad dosh. So Agni Karma in Grudrasi is performed at maximum tender point, and Samyak Twakdagda Vran are made, and significant relief in the pain is observed. Agni Karma has an excellent result in Asti Sandigatvat and Grudrasi. Agni Karma is highly effective procedure, but it has its complication. Complication of Agni Karma by faulty application of Agni Karma can cause loss of sexual potency, retention of urges, severe colic pain, profuse hemorrhage, relapse of healed wound, wetting and prolapse of anus, and may cause immediate death. Thank you so much, everyone.
Thank you, doctor.
Next, I invite Dr. Mahima Patel for the poster presentation. Dr.
Yes, sir.
Mahima.
Yes, sir. Yes, sir. Good evening, everyone. My name is Dr. Mahima Patel, PG scholar, Department of Prasuti Tantra and Stri Roga from Rajasthan Ayurveda University. Today, my topic is Ayurvedic approach for a female infertility. First, infertility, besides being a health issue, is more of a social problem which affects the personal, social, and the mental health of affected person. And it is estimated that 10 to 15% of married couples suffer from infertility. So this infertility also explained in our Ayurveda as called Vandyatva. Vandyatva means a nasta artha is explained by the Acharya Sushruta. It means any pathology in artava that will lead to infertility. Then also according to Acharya Charaka, Yada Hashyaha Shonite Garbhashaya Bij Bagaha Pradosham Mapadyate Tada Vandyaha Janiyati. It means Garbhini take Dushita Ahar Vihar that lead to a dosha. Dosha likes all the three dosha, and that leads to vitiate the Garbhashaya and Rakta of a particular female, and which will lead to, after a Garbha formation, it is a vitiate Garbha Bij Bhaga, and that responsible for female gives a Vandya Stri. Then according to Harita, it is also gives the Vandyatva types. Kakavandya means a one child infertility, means patient have already pregnant one child, then it is not a failure to conceive subsequently. It is called the Kakavandya. Then Anapathya means no child. Garbhastravi means repeated abortion. Mrutavatsa, repeated stillbirth. Balakshaya, due to loss of bal, or Garbha Kosha Bhanga, the prolapse of uterus. So these are the types of the Vandyatva. Then in Ayurveda only explain a Garbha Sambhava Shamagri, that is a factors which are responsible for a natural pregnancy natural fertility, and which are the Dhruvam Chatunat Sannidhyata Rutu Kshetra Ambu Bija. Rutu means a fertile period. So in Ayurveda explain the fertile period means day 8 to day 16. It is a safe for the intercourse or for a fertilization. So by simply counseling a patient about this fertile period, we can patient can achieve the pregnancy normally. Then second one is Kshetra. Kshetra means include uterus, fallopian tube, ovary, vagina, and cervix. These all are the reproductive organ, and these are the responsible for the natural pregnancy or natural conceived fertility. So these are any pathology are created in this organ which lead to infertility. The next is Ambu. So we can use Ambu as a endocrine system because of the because for a natural fertility, a reproductive system are activated. So for that reason, the neuroendocrine system is activated must. Then next is the sperm and ovum. These are also responsible for a fertility. Then other causes like the Artavadushti, various Yoni Vyapad, Yoni Arsh, Artavah Stroto with, Artavah Stroto with also explain a Vandyatva, Atibala, Ativruddha, and chronic diseases, Mansika Abhigata, Mithya Ahar Vihara, Bij Dosha, Daiva means unexplained infertility, and disturbed mental state. So these all are the factors which lead to infertility. Is any pathology created in a normal reproductive system which lead to infertility? And for that, we can use a principle of the treatment according to Ayurveda and treat infertility. So first, counsel the patient about the fertile period. It is the main goal of our for cure the infertility. Then Nidana Parivarjan. So all are the Nidan that lead to infertility, which are avoid for not any pathology. Then first Agni Dipana. So Agni Dipana, it is also responsible for the Pachana Chikitsa, and also any other drug used that are proper work in this system. For that reason, Agni Dipana is necessary. After that, we can use Rasayana, Balya, and Dhatu Poshak drug, mainly acting on Rasa and Rakta according to disease condition. Then use of the Prajastapaka Dravya, Tridosha Shamak Chikitsa, mainly a Vata pacifying. Then use a treatment of the responsible causes like the Yoni Vyapada Chikitsa, Shukra Dosha Chikitsa, and Artava Dushti Chikitsa, etc. Also, we can use a Panchakarma Chikitsa like a Snehan Shvedana, Vamana Virechana, Niru, Anuvasan, Nasya, and counseling for the Somanasya, means the healthy mental status. And we can also use Ayurvedic medicine that are explained in Ayurveda according to a various factor. In that, for ovarian factor, we can use a single drug as a Ashoka, Shatavari, Ashwagandha, Dashamula, and Kumari. They are having phytoestrogen properties, and for that they activate the HPO axis. And compound formulation, Chandraprabhavati, Yograj Gugulu, Ashoka Arista, Dashamula Arista, Pushpa Danvaras, and Mahanarayan Tel for Nashyam. Then in case of the PCOS, we can use Kachnar, Latakaranj, and Varuna. So they are having the Lekhaniya properties. And in a compound formulation, Kachnar Gugulu, Arogyavardhini Vati, and Punarnava Gugulu. Then for a tubal factor, to remove the tubal block and adhesion, and to improve the ciliary action, we can use Guduchi, Katuki, and Punarnava. And they are having a Sothagna property which help in a tubal factor. And we can also use Uttarbasti with a Kshara Tela, Lashuna Tela, and Danvantara Tela. Then in a uterine factor, to improve the endometrial quality and thickness, we can use a single drug as a Shatavari, Ashoka, and Bala. they are having a balya properties and useful for the improve the endometrial thickness. And also we can given a uttarbasti with a phalagrita, ashwagandha krita and bala taila. Then in a cervical factor, to improve the cervical incompetency and to remove the cervical erosion, we can use a Shara Taila, Shirabala Taila as a Yoni Pichu, Phalagrita and Yoni Dhavana with a Trifla Kwata, Panchvalkal Kwata, Varunadi Kwata and Nimba Kwata. Then it no counseling for the Somanashya. The psychological factor is also responsible for the fertility. In that case, we can use the Saraswati Arista, Mukta Pisti, and Shirodhara with the Taila, Dashmulakwata, and Milka and Takra. Thank you.
Thank you, doctor.
Oh,
Next, I invite Dr. Pawan Sanjay Bantari for the paper presentation. Dr. Pawan.
Yes, sir. Am I audible, sir?
Okay, doctor. Audible, doctor. Please share the screen.
Yes, sir. I'm sharing the screen, sir. Allow me.
Okay, doctor. Please share, doctor.
Hello, all of you. Good evening. Myself, Dr. Pawan Sanjay Bantari, PG scholar, final year, Shalakya Tantra, Department Shalakya Tantra. So, my topic is Ayurveda treatment on Mukhapak, that is stomatitis. So, introduction. Stomatitis is an inflammation of the mucus of the oral cavity. It is an inflammation of the lining of the mouth. Stomatitis causes. Stomatitis can be caused by local and systemic cause. Such inflammation of the mouth may be caused by injury, mechanical, chemically, thermally, radiotherapy, idiopathic, malnutrition, etc. Type of the stomatitis. First, traumatic stomatitis. Second, infectious stomatitis. Subcategory, viral stomatitis, bacterial stomatitis. C, angular stomatitis. D, stomatitis with malnutrition. Mukhapak. In Ayurveda, Mukhapak is one of the Mukha rog and occurs in all over the oral cavity. Acharya Kashyap Charak has described it as a Mukhapaka, while Acharya Sushrut and Acharya Vagbhat have described it as a Sarvasaraha. Sarvasaraha means the disease which have capacity to spread all over the buccal mucosa. Causes of Mukhapak can be differentiated as Dosha Dushtikar Hetu, Sthana Vaigunyakar Hetu. So first, those Dushtikar Hetu. It includes Aharaj Hetu, which causes aggravation of Pitta dosha in Amashay and causes Mukhapaka. Hetus like Manasahar, Dugdahar, Ikshuvikruti causes vitation of doshas in Amashay and thereby causing Mukhapaka. Second, Stan Vaigunya Hetu. It mainly consists of Viharaj Hetu. This causes aggregation of doshas in Mukha. In case of sleeping in prone position, collection of Prakupit dosha in oral cavity leads to Mukharoga. Types according to Ayurveda, Acharya Sushrut mentioned in Sushrut Nidan 1664, Mukharoga Panchashashtir Bhavati Saptasya Ayaneshu Tatra Ayatani Oshto Dantabulani Dantaha Jivaha Talu Kantha Sarvani Cheti Tatra Ashtave Oshtayo Panchadashaha Dantamuleshu Ashte Danteshu Panchajivaha Navataluni Saptadashe Kante Treye Sarveshayan Sarvesha Nishu. So, Sarvasarastu Vata Pitta Kapha Shonita Nimittaha, according to Sushrut Nidan 1664. So, my drug is honey. Actually, the properties of honey are Rasa Madhur, Virya Sheet, Vipak Katu, Dosha Karma, Vata Pitta Kapha Shamak, Karma, Vranaropak. Honey has been described in ancient and modern medicine as being effective in the healing of various wounds, healing of burns, ulcers, and open wounds, which believed to be related to its constituents since fructose, the predominant sugar in honey, is very hygroscopic. Honey, known as madhu, is one of the most important medicine used in Ayurveda for both internal and external applications and mainly used for treatment of eye disease, cough, mouth ulcers. It acts as an oral antiseptic and astringent, anti-inflammatory, and expectorant. So, drug review, Mukhapak versus honey. as Madhu. Stomatitis is considered as one of the prevalent oral disease worldwide, characterized by redness, ulceration in oral cavity, with burning sensation, salivation, and pain. However, Ayurvedic treatment for this disease are safe, effective, cheap, and non-toxic. Mukhapak, often called as Sarvasara Roga, is a disease of oral cavity characterized in Ayurveda as the Pakwa Avastha of oral mucosa and produces ulcer in oral cavity. Pitta dosha, Raktavana, and Masa are the main dusha in Mukhapaka. According to Acharya Sushruta, there are 65 Mukharoga which occur at 7 locations such as lips, teeth, tongue, palate, throat, and oral cavity. And out of them, 3 in entire mouth. To break this samprapti, Pitta dosha ahar, Rakta Prasadak, Vrana Shodak, Vrana Ropak is essential. As per Ayurveda, the line of treatment for Mukhapak should be Pitta Shamak, Vrana Shodhana, Vrana Ropana, Rakta Prasadak, Masa Dhatu Pushtikara. The clinical symptom of Mukhapaka is comparable with stomatitis. So, case study of Madhu versus Vrana Ropaki Mukhapaka, that is stomatitis. A male patient of age 23 was came during OPD of Department Shalakya Tantra, having complaint of redness in mouth, ulceration in oral cavity, burning sensation, salivation, and pain. The ulcers are inside the dates is 3 to 4 days. Patient was HB 10.2, total leukocyte count 10,000, ELCP 75%, PSR 21, platelet count 3.52 lakhs. Application of Madhu as a local application. Patient applied Madhu for 7 days. Treatment Parivarjan is the first advice to store audits of oral hygiene. So the table shown that symptoms before treatment are so the treatment sensation, first follow-up, next follow-up after 3 days, it is only single plus. So 2 plus follow-up after 3 days, it is eliminated. Mukhavrana, 4 plus are there, first follow-up after 2 days, next follow-up after 3 days is plus 1. So results are after 1 week. The first photo is before treatment and second photo is after treatment. So result and conclusion, result of the present study demonstrated highly effective, therapeutic and significant potential of Ayurvedic medicine in management of Mukhapaka or stomatitis. It may be due to anti-inflammatory as well as healing property of Madhu. Study demonstrated and confirms that local application of Madhu is the so far simplest, economical and effective drug therapy in the management of Mukhapaka. Conclusion, present study shows that stomatitis of the commonest oral disease in India and found in all the age groups. Local application of Madhu is effective medication for the treatment of Mukhapaka, that is stomatitis. These remedies are being practiced in Ayurveda and are cost effective and easily available. So thank you, sir.
Thank you, Dr.
Doctor.
Pawan.
So next I invite Dr. Hari Krishnan for the paper presentation.
Good evening, Doctor. Good evening, all. I am Dr. Hari Krishnan H, second year PG scholar, Department of Shalakya Tantra, SDM College of Ayurveda and Hospital, Hassan. So today my topic of presentation is Ayurveda in prevention of eye diseases. So as we all know, the most important sense organ, that is the eye. Chakshurayanam sarvakalam manushyaritya kartavyo jivite yavadichaha virtho loko ayam tulya trividanam pumsam adhanam vidyamane apivitte. Which means for the man who is blind, the world is useless and the day and night are the same, though he may have wealth. This is according to Ashtanga Hridayan, and according to Sushya Samhita, we know that Sarvendriyanam Nayanam Pradhanam. Now, prevention of lifestyle-based eye diseases, and one of the lifestyle-based eye diseases is diabetic retinopathy. Through Ayurveda, we can prevent the further progression, complications can be avoided, the vision can be preserved, and the intravitreal interventions and surgeries can be prevented. And how we can prevent that? Through the Kriya Kalpa procedures like Ashotana, Tarpana, Talam, Padabhyanga, etc. And prevention of ocular manifestation of systemic diseases. So one of the systemic diseases which is very common is the retinal vascular diseases like CRVO, BRVO, etc. And we can prevent these diseases through Kriya Kalpa treatment, Panchakarma, Yoga Pranayama, and healthy dietary regimens and lifestyle. And this is one case of DRVO, and through which we could give a successful result over the course of 7 days through Kriya Kalpa treatments. And next is prevention of pharmacological hazards only. Many topical drugs can, which are used for glaucoma, can cause uveitis. This is a case of acute uveitis, which we could treat successfully in a span of 1 week, where we did Seka, Pindi, Bidalaga, etc. And prevention of occupational hazards. And one of the most common occupational hazard is computer vision syndrome, which we can prevent through Kriya Kalpa, avoid excessive usage of screen, and regular breaks while using screen, eye exercise, and eye agronomic tips. And next is prevention of geriatric diseases. And one of the most common geriatric diseases which affects the eye is ARMD, age-related macular degeneration. And we can prevent it through the Kriya Kalpa treatments. And prevention of eyesight in visually compromised patients. Example, pathological myopia. And next is prevention of congenital and hereditary eye diseases, which we can prevent through preconceptional therapies, Rasayana Chikitsa, Siddha program, Panchakarma procedures, and Kriya Kalpa procedures. And prevention of surgical interventions in eye disease can be prevented mostly by Kriya Kalpa and eye exercises. And eye health can be mostly promoted by the dravyas like Eshtimadu, Guduchi, etc. And other procedures like Kriya Kalpa procedures. And other than all these procedures, one of the most important factor is diet. And diet is the factor responsible for nourishment and production of Sara, Mala, and Upadadus. And one more property which we should remember is the Vyadhikshamatva. And Vyadhikshamatva is the ability of the body to prevent disease, and also its ability not to result in disease even when exposed to pathogens. And these are the Apathyas which can cause eye diseases. And sour items like curd, pickles, etc., Vidahi items which can vitiate Pitta is one of the main factors of the cause of eye diseases. And Viruddha aharas like milk with fish, hot and cold items together. And other habitual and occupational factors are hot water, head bath, and excessive smoking vitiates Pitta. Looking at too small or too distant objects, continuous watching of movie, etc., also can cause eye strain. Air pollution and too much light are also in the main causative factors of eye diseases. Traveling in high-speed vehicles exposes eye to current airs and dust particles. Also, eyes get tired due to constantly adjust to the changing directions. And Patyaharas are grains such as Yava, Goduma, Shashtika, Mudga, which are old and mitigate Kapha and Pitta. And vegetables, meat of Jangala, and Dadima, etc. are Patyaharas. And Nasya is one of the most important procedure which can prevent the eye diseases. Anutaila Nasya is advised because it cleans the strothus by its action, and in turn, it prevents the accumulation of vitiated kapha in strothus of eyes. And another one important procedure is Padaraksha. Medicines applied over the feet massage, external application of massage of feet is advised because it is assumed that in the center of feet by the accumulation of malas, assault, trauma from stone, foreign particles, etc. And another one important procedure which can prevent the eye diseases are the eye exercises, and these are some of the eye exercises. Thank you.
Thank you, Dr. Krishnan.
Next, I invite Dr. Srilakshmi CG for the paper presentation on the topic therapeutic procedures in Shiroroga.
So today I'll be presenting on the topic of therapeutic procedures in Shiroroga, and myself, Dr. Srilakshmi from the Department of Shalakya Tantra, second year PG scholar from STM CAH Hassan. So the procedures involved in therapeutic involvement of the Shirorogas are the Murni Tailas, Prachanna, Talapurichil, and Shiraveda can be done.
First, we'll see about Murni Taila. Muda means head and Taila means oil, as we all know. Murni Taila is a type of treatment in which various procedures can be carried out with various decoction, medicated Grita, Taila. It remains in contact with the scalp for fixed duration of time. It is one of the Bahya Snehana. There are basically 4 types of Murni Tailas: Shiro Abhyanga, Shiro Seka, Shiro Pichu, and Shiro Basti. And it is said that it is that is Shiro Abhyanga is Shiro Basti is more potent than Pichu and Seka and then Abhyanga. First, we'll see about Shiro Abhyanga. It can be divided under 3 headings: Pradhana Karma. Pradhana Karma is the time performed at any time of the day. It can be performed at any time of the day before bath. Position, it should be in sitting position at a knee-height chair. And the oil should be lukewarm and should be slowly applied gently to the hair and scalp in the direction of the hair follicles. It should be done gently with the fingertips. It can be done under 9 steps: smearing of the oil, Garshanasta, Mridvangli Tadana, Dvihasta Tadana, Taranga Hasta, Anguli Kridana, Mrudumushti Tadana, Shabdanguli Kridana, Gatita Hasta. And Paschat Karma of Shiro Abhyanga, the patient is advised to take rest about 10 to 20 minutes and then allowed to take head bath with Sukoshna Jala. Indication of Shiro Abhyanga, it helps in all type of Shiro Rogas, Shirashula, Kalitya, Palitya. It provides good luster to face, reduces Tvak Vikaras. It helps in the Tarpana of all the 5 Indriyas. It helps in reducing Rukshata, Kandu, Mala of the Shiro Pradesha. Contraindication of Shiro Abhyanga in case of Kapha dominant diseases in Ajirna, Taruna Jvara, Amadosha, Ati Santarpana, and who are given with Vamana Virechana Nirohabasti, and Shiro Abhyanga is contraindicated soon after food. Common Taila yogas used are Prapondarikadi Taila, Brahmi Taila, Nimbadi Taila, Trifaladi Taila, etc. Next, we'll see about the Shirodhara. Shirodhara or Seka, the flow of thin stream of Kashaya or Takra or Ikshurasa, Kshira, etc. over the forehead that allows the flow over the scalp in a specific rhythm is called a Shirodhara. It is also indicated in Arumshika, Shiratoda, Daha, Paka. Purvakarma to Shirodhara is the Sanika Abhyanga to be done to the face, neck and shoulder. Then gauze is tied around the head and below the eyebrows of the patient. Cotton swab to be kept in the ear. Pradhana Karma, the patient is made to lie on the table in supine position. Dharapatra should be adjusted over forehead so that the distance between the wick and the forehead remains 4 anguli. Then the Sukoshna Taila is poured in the Dharapatra. Lukewarm Dara in Vata and Kapha condition, and Shita Dara in Rakta and Pitta condition is indicated. Usually it is done for a period of 1 to 1.5 hours, depending upon the bala of the patient. The appropriate time in Pradhana Kala, that is, it should be done during the morning time. And Paschat Karma to Shirodhara, it's the head of the patient should be wiped off with the cotton cloth. And some of the snehas that can be selected depending upon the doshas are Vata, it can Tila Taila can be selected, Pitta, Grita can be selected, Kapha, Tila Taila, and Vata, Pitta, Rakta, Tila Taila and Grita in equal amount, and Vata, Kapha, Rakta, 1 part of Tila Taila and half part of Grita. Some of the Taila yogas used are Himasagara Taila, Brahmi Taila, Grita, Seka, or lukewarm milk in Vataja Shirashola is also indicated. Next is the Shiro Pichu. Cotton pads cooked in the herbal oil is kept over the head and tied with a bandage for the fixed duration of time. And Pichu helps in the absorption of the drug, in slow absorption of the drug. Pradhana Karma, patient is asked to sit on the chair with the knee height, and then the cotton pad having a length of 16 centimeter in length into breadth is soaked in lukewarm oil and kept over the Brahmarandra of the patient and tied with a gauze. It is indicated in the condition like Kesha Shata, Kesha Pushtana, Netra Stamba. And it can be lived up to the duration of 30 to 90 minutes. Common Taila yogas used are Trifaladi Taila, Bhala Taila, Kshirabala Taila, Brahmi Taila, Shatapaka Taila, etc. And last, the Murni Taila is the Shiro Basti. Shiro Basti is the pulling of medicated oil or over the head for the fixed duration of time. The oil should, the leather strap around 12 angula should be kept over the head circumference, should be wrapped around the head and tied just above the ear.
The joint of the intervening space should be packed with a paste of masha or other to prevent leakage of oil. The medicated oil prescribed for the disease is poured over the head in lukewarm condition to a height of 1 angula over the scalp. Time duration of Shirobasti depending upon the dosha. In Vata Vyadis, it is 1000 Matrakala, and Pittaja 800 Matrakala, Kafaja 600 Matrakala, and Swasta 1000 Matrakala. According to Vagbata, duration is 3 or 5 days or 7 days. Sharangadara 5 to 7 days. Shushruta up to 21 days. Paschat Karma, oil is removed with a spoon or sponge from the compartment and the patient is made dry. Massage is to be done, given to the head, shoulder and neck. Indication of Shirobasti is Ardita, Anidra, Nayanasya Shosha, Shiroroga. Thailas used are Brahmi Thaila, Dhanvantara Thaila, Mashabaladi Thaila. Next is the procedure Tala Purichil. Tala, the word comes from the Malayalam vocabulary, which literally means to cover the head. This is a procedure prepared medicine in the form of semi-solid paste is applied. The preparation, how the drugs are selected as per the disease condition of the patient and are prepared by either boiling or soaking the drug with buttermilk. Drugs having fresh juice need not be soaked and directly made into paste. Pradhana Karma, scalp should be free of hair. It should be, and the lepana required thickness should be applied all over the head. And the paste of the from the vertex position is removed and dipped and get it filled with a suitable oil. The procedure is done for about 30 to 90 minutes. Indicated in conditions like autism, ADHD, eye disorders, etc. And next is the Prachana Karma. Sushruta is considered it's one among the Raktamokshana and it's one of the 5 Shodhana procedures. Pradhana Karma, it is one of type of Raktamokshana. Kursha Shastra is used to make multiple pricks and on the affected area and ooze out the vitiated blood. Indicated in Kalitya, Indralupta, Tvakvikaras and Granthis. Procedures. Pricks are made from the bottom to upward direction. Pricks are made with parallel to each other. And the prick should not be too deep or too superficial and it should not be one over the other. Thus, the whole area of the scalp should be involved. The unsatisfactory amount of blood oozes, the tourniquet has to be removed and excessive bleeding is observed when Raktamokshana drugs like Ushiradi Churna has to be applied. It is indicated, its reference is seen in Kshudra Roga Nidana in Sushruta Samhita and Indralupta diseases and in Kalitya in Shiroroga Adhikara of Ashtangaradaya. Thank you.
Thank you, doctor. So next I invite Dr. Preeti P. I invite Dr. Preeti.
Hello, good evening, doctor.
Good evening.
Am I audible?
Yes, doctor.
Yes, Dr. Audible.
I've shared my screen. Is it visible?
Yes, Doctor. Please start the session.
Very good evening to one and all present here. Respected delegates from the panel, coordinators, and all my dear friends. I'm Dr. Preeti, second year PG scholar, Department of Shalakya Tantra from SDM College of Ayurveda and Hospital, Hassan. So today I shall be presenting a case that we came across in our OPD and our approach to treat it by using Ayurvedic procedures and Ayurvedic treatments. So we have recorded it on a regular basis and this is how it went. So a 28-year-old male patient presented with a history of trauma to the right eye at his workplace. The patient complained of pain, photophobia, redness, lacrimation, swelling of the eyelids, and diminished vision in the right eye. As you can see in the photograph that I've posted here, the patient had not sought any treatment elsewhere for the same and later approached a hospital 2 days after the said incident. So as part of history recording, the patient is not a known case of diabetes mellitus and hypertension and is not under any medication. So as per the protocol, we started by examining the eye. So the basic examination of the eye started by examination of the eyelids. So the right eyelid, which was injured or which had undergone trauma, was found to be edematous. However, there was no matting, blepharospasm or trichiasis in the said eye. The lacrimal apparatus By doing the regurgitation test, it was negative, and also the skin over the lacrimal sac was found to be normal in both the eyes. Coming to the conjunctival examination, as it is already clearly seen in the previous picture, there was a very evident circumciliary congestion which was present. However, there was no chemosis and follicles and papillae were absent. So coming to the examination of the cornea. So first, we stained the injured eye, by using a fluorescein dye, and this revealed presence of a grayish-white ulcer in the right lower quadrant on the temporal side of the right eye. So further, on doing a slit lamp examination after staining, the dye revealed a disturbed corneal surface due to the presence of an ulcer in the right lower quadrant on the temporal side. So the lesion appeared to be grayish-white in color, and it had elevated and rolled out margins. Then the corneal sensations were found to be diminished, as it was a fresh case of a trauma, and no corneal vascularization was found. Further, on examining the anterior chamber, there were no signs of flares or cells. So this indicated the absence of uveitis, as the patient had approached us without undergoing any treatment or consultation after 2 days of the incident. The iris was found to be normal, and the pupils were found to be round, irregular, and reactive. So this is the picture of the fluorescein stain, which was done to the right eye on day 1. That is when the patient came to our hospital for the first time. So the visual acuity which was recorded was as follows. However, there was no pinhole improvement. So the right eye was the eye which was injured, and it had a vision of 6/36, whereas the bilateral vision was 6/9, and even the near vision was N12. So since the patient presented with severe photophobia, lacrimation, redness, there was a difficulty to the patient to read the examination chart. So the stain, as I said, the stain was retained by the ulcer, and on doing the slit lamp examination, the ulcer was found to be present in the right lower quadrant on the temporal side. So based on the symptoms that we've seen in the patient, and based on the signs that were observed, we came to a conclusion regarding the differential diagnosis. It could be either fungal keratitis or bacterial keratitis. So the reason that we attained or came to the conclusion that it might be one of the two were because both bacterial and fungal keratitis, the source for both these conditions is a trauma, and specifically a trauma which is caused by a vegetative foreign body, which was the case in our patient. Also, both the keratitis present with symptoms of lacrimation, redness, as well as eyelid swelling, and there is edema which comes along with it. And since it is the case of a trauma, there is always a diminished vision when the patient approaches us for the first time. So if you see the main features of bacterial keratitis, the ulcer or the lesion should be yellowish white, and the margin should be swollen, and it should be overhanging. That is, it should be covering the ulcer which is made. Whereas when we see fungal keratitis, the margins have to be elevated and they are rolled out, and the lesion is grayish white. So based on the signs which we saw in our patient, the lesion was grayish white in color, and the margins were elevated and they were rolled out. So we came to a conclusion that it has to be one among the two. So based on the signs, it matches more or sits appropriately more with fungal keratitis. So coming to the Ayurvedic aspect, so this condition comes under Savrana Shukla. As Acharya Sharangadhara has already told, Shatam Praharaha Tathaiva Shukram Yatra Drishyate. So any sort of trauma to the Krishna Mandala will lead to this condition, and specific symptoms and signs have been mentioned by Acharya Sushruta. He says, Nimagna Rupam hi bhavetu Krishne, Sucheva Vidham Pratibhati Yadvai, Sravam Sravet Ushnam Ativa Rupcha Tat Savrana Shuklam Udaharanti. So all the four, the entire shloka was easily, entire signs and symptoms which are told in the shloka were exactly seen in the patient, right? So this symptoms which were presented by him were Ruk and Sucheva Vidham. That is, there was pricking sensation which further led to photophobia, and the signs which we saw were Nimagna Rupam, that is, there was a proper ulceration as the ulcer had penetrated into first two layers of the cornea. And then there was Srava, that is continuous lacrimation, which was being seen. So based on this, we came to a conclusion that the final diagnosis of this condition was Savrana Shukla or fungal keratitis. Now, generally, Savrana Shukla is a Raktaja Asadhya Vyadhi. However, Acharya Sushruta mentions specific conditions wherein he says that if it is Drishtehe Samipe Na Bhave, so in this condition, the ulceration or the lesion was nowhere close to the pupil. That is, the lesion was not a cause for diminished vision, and hence this was taken up. Further on, Acharya Vagbhata, he specifically mentions that yapyam tu dvitiya patala vyadhat. By doing a slit lamp examination, we could see the depth of the ulcer, which had penetrated into 2 layers of the cornea. So we could consider this as a dvitiya patalagata savrana shukla, and how as it is said to be yapya, so we had taken it for further treatment. So this is the treatment protocol that we had advised. So orally, the patient was given Panchatiktaka Gugulu Grita, 10 ml on an empty stomach with warm water for a period of 15 days. Then I plus eye drops was prescribed, which was supposed to be instilled 2 drops every 2 hours for the first 5 days. Then 2 drops thrice a day for the next 10 days. Then internally, we had administered Shodhak syrup and capsule grab. So when we see the classical reference regarding the chikitsa of Savrana Shukla, it starts with the procedure of Gharshana, then Anjana, then Tarpana, if it is Dvitvagata. As the patient came to us on an OPD basis, and as he was not a patient who could afford extra treatments, so we went with the 4th major protocol, that is your Gritapana. Gritapana has been mentioned by Acharya Vagbhata, and he specifically mentions intake of Triphala Gritapana or Trivrit Grita. So the choice of Grita here was Panchatiktaka Gugulu Grita, because majority of the ingredients in Panchatiktaka Gugulu Grita are Kashaya and Tikta Rasa Pradhana. So Kashaya Rasa, and also there are many ingredients which are Ruksha and Tikshna. So most of these have the property of Shoshana, which is, as it is a vegetative foreign body, it has a chance of further growth and further infection. So in order to control that, as it is a vegetative foreign body, it would have certain amount of moisture content. So in order to grab that, or in order to stop that growth, Panchatiktaka Gugulu Grita was taken as the first protocol among the Gritapana. Then we followed with I plus eye drops, which has ingredients like Padmaka, Tulasi, Jati, Shatapatra, Durva and Madhu. So most of these are Shita Virya, and most of these are soothing to the eye. So this helped to combat the patient with lacrimation and photophobia. Moving on, grab. Grab is the ingredients of grab mainly include ingredients like Gandhaka Rasayana, Guduchi, Triphala Gugunu, and Vranapa Harirasa. All these are the drugs in this particular medicine, which helps in curbing the infection and prevents it from further spreading. Right? And syrup shodhak includes Mahamanjishtadi Kashaya and Nimba Kashaya, which also further helps in preventing the spread of the infection. So this was the treatment protocol which was given. And as I said, this was taken up because it is considered as yapya, and this was drishte samipe na bhavet. It was, the lesion was nowhere close to the pupil. So this is the follow-up. We did a follow-up on day 3, and we did a follow-up on day 15 after prescribing the medications. So as you can see, the follow-up on day 3, the patient had reduced complaints of photophobia and redness, and also the lacrimation had reduced when compared to day 1. However, as you can see, it was a little difficult for the patient to open the eyes completely due to little bit of existing photophobia and redness. However, the vision improved in the right eye from 6:36 up till 6:12. And when the patient came back to us on day 15 for the follow-up, all the complaints of photophobia, pain, redness, and lacrimation were completely reduced. And the vision properly improved up till 6/9 partial. So this...
Dr. Preeti?
Sorry, yes, ma'am.
Dr. You are exceeding the time limit. Please.
Okay, I'm done, ma'am. I'm almost in the end. So, the final picture, that is the follow-up on day 15, shows a completely healed ulcer with the retaining opacity. Thank you.
Thank you, Dr. Preeti.
Thank you, doctor.
Dear participants, please try to present your topic within the time duration. So next I invite Dr. K. Vigneshwaran for the paper presentation. I invite Dr. Vigneshwaran.
Am I audible?
Yes, Doctor, audible.
Good evening, respected doctors, respected delegates, and chairpersons. I am Dr. Vigneshwaran, doing my second year PG, Shalakya, Tantra Department, doing at SDMC Hospital, Hassan. My topic for presentation is establishment and importance of
Nasahi Sirisodwaram. So Nasahi Sirisodwaram once again. So it is stated in Ayurvedic classics that there is a very close relationship between the Nasa and the Siras. So Nasa is the gateway of the brain, and almost in all Samhitas, Nasya is indicated for all Urdu Jadurgata Vyadis. So drugs administered to the nasal cavity rapidly transfers through the cribriform plate into the CNS by three routes: directly by olfactory neurons, through supporting cells and the surrounding capillary bed, and directly into the CSF. So the effect on neurovascular junction, that is the Purva Karma of the Nasya procedure. Actually, importance of Purva Karma in Nasya Karma is to facilitate for the drug absorption through nasal neurons and paranasal sinuses. In this, the repeated Panipada Svetana causes an impact on blood circulation to head. So the vasodilator effect over the superficial surface of the face facilitates for the drug absorption. And the second aspect of Purva Karma is the posture. That is, the posture mainly creates the patency in channels of nasal cavity and nasopharynx. The drug administered reaches the upper part of the cavity and stimulates the olfactory neuron. That's how this Purva Karma helps in the Nasya Karma to facilitate the action. And Pradhana Karma, during this explanation, the classics have mentioned one more structure, the Srinkataka Karma, where there is an association organ, that is Akshi, association with Grhana, Akshi, Shodra, Jigva, Siras are present. Acharya Charaka says the Sneha Pradhana Namana Dravya gets absorbed in the Srinkataka region. So through Srinkataka, the Nasya Dravya gets absorbed into the Siras. So the above reference by the scholar says lipid-soluble drugs are much more efficiently absorbed by the nasal mucosa. Hindu also commenting the same, that the exact sthana of the Srinkataka Marma, which can be considered for the middle cephalic fossa. That is Siraso Andar Madhya Murda. Hindu commented clearly, Siraso Andar Madhya Murda. That can be considered for middle cephalic fossa. The middle cephalic fossa is a region which, in connection with ethmoidal and sphenoidal sinuses, consists of meningeal vessels, mainly internal carotid artery, and also optic nerve. So the Pachat Karma, this facilitates by the following during the procedure, mainly the drug absorption. This starts with Mardana over the frontal, temporal, maxillary, mastoid, and neck region. After administration of the drug, when the drug reaches the distal end of the airway, the patient is asked for the Nistivana Kriya. The medicine should reach on both sides of the throat, otherwise the drug absorption doesn't occur in the Siras properly. So, Udu Jadru Vikaresha Visheshat Nasya Mishyate Nasahi Sirisodwaram Tena Tadavya Handitan Nasta Karma Chapurvadi Shirorogesu Sastravit Dwaram Siraso Nasa Tena Tat Vyapya Handitan. Both Charaka, Ashtanga, almost all Acharyas mention Nasa is the gateway of the Siras. So in Shishruta, Ashtanga, Saraganta, etc. classics, detailed description are not found about the mode of action of the Nasya. So this is my concern, that Nasa is Rasodwaram. There is possible facts to understand this concept. So the drug administered through Nasa, as Nasya reaches to brain and eliminates the morbid doshas responsible for the diseases, mainly Srinkataka Marma. It's a Shira Marma, Sadyopranakara Marma, and it can be possibly correlated with the cavernous sinus, which is the large venous plexus that lies on both sides of the sphenoid bone. As per the classical description, the Srinkataka Marma is situated within the confluence of the Siras, nourishing the Chakshurati sense organs, and exact locations difficult to understand, as the exact landmarks are not mentioned like other marmas. So the literal meaning of Srinkataka is indicating cluster or group, joining place of four ways. The word meaning is appropriate for correlating the Srinkataka Marma with cavernous sinus, since this is having communication with the cluster of veins in all four directions, and therefore the meaning is relevant. So by this, we conclude that the drug through the nose reaches the middle cranial fossa, constitutes the cavernous sinus, intercavernous sinus, carotid artery, etc. Almost in all Samhitas, Nasya is the main line of treatment for all Urdu Jadrugada Rogas. So it's having synonyms like Sirovireka, Murdavirechana, and Nastakarma. So also in Mada Murcha Sannyasa, Tikshanasya is indicated in almost all Ayurvedic texts, which shows the Nasya Dravya is going deep, crossing the blood-brain barrier and blood CSF barrier. Even in acute Pakshagada, Ardhita, like cerebrovascular diseases in CVA cases, ischemic occlusion, Tikshanasya plays a very important role in thrombolysis of infarct. So its importance and effect on neurovascular junction. Since skull base is located at the roof of the nasal cavity, is in close vicinity to the CNS, the nose to brain delivery is a minimally invasive drug administration pathway which bypasses the blood-brain barrier as the drug is directed from the nasal cavity to brain. So nose to brain transport can either be mediated via the olfactory or the trigeminal pathway. Also, the nasal epithelium contains pseudostratified columnar epithelial cells, globate cells, mucous cells, and serous glands, which enhances the absorption of nasal drugs into the brain. Under the complications of Nasya Karma, Shushruta explains the excessive elimination, that's the excessive eliminative Nasya Karma causes Mastulangakshaya. So this also proves that the Nasya Dravya acts on the cirrus. On this basis, we may say that ancient scholars of Ayurveda are aware of drug transportation by lymphatic path can reach direct into the CSF. It is known that arachnoid matter sleeve is extended to the submucosal area of the nose along with the olfactory nerve. So Nasya effect on neuroendocrine level. The humor behind the recommendation of the Nasya by the Acharyas in the Pumsavana for changing the sex of the fetus, that is, drugs used for Pumsavana may be acting through the olfacto-hypothalamo-pituitary pathway. That is, through the olfactory pathway, influencing the hypothalamus, which in turn causes the inhibition effect through the pituitary. So, Nasya, it even effect on the neuroendocrine level it proves. So, Nasya effect on the limbic system, that is, certain drugs administered through the nose may have an impact on immediate psychological function by acting on limbic system through the olfactory nerves. So these things certainly support the recommendation of Nasya for mental disorders like Apasmara and Unmada mentioned by our Acharyas. So it proves this acts on the limbic system also. So Nasya in pediatric casualty. Actually, in contemporary science also, Nasya through the nasal pathway only, many emergency casualty they are handling. For example, midazolam spray in pediatric seizures and sedative nasal spray in pediatrics for minor diagnostic procedures, foreign body removal, analgesics in carcinoma patients, etc. And naloxone nasal spray is used for the emergency treatment of opioid overdose. So naloxone is the antidote for the opioid overdose, and it reverses the opioid effects. And route of administration is through nose only, nasal spray. So glucagon nasal spray in hypoglycemia. So these things once again proves the importance of Nasya Karma acting on cirrus, which was mentioned by our Acharyas many years ago. Finally, even in Valmiki Rasayana, the use of Sanjeevani for Nasya Karma, when Lakshmana became unconscious, drugs were blew by Sheshana to make him conscious. So in Valmiki Ramayana itself, the importance of Nasahi Srasodaram is mentioned. Conclusion, the facts discussed here is also convincing us about the definite effect of Nasya Karma in the disorders of CNS, psychiatric, limbic system, and some endocrine disturbances also. So Nasya Karma is used both to manage the Sthanika and Sarvadaika anomalies, and the relevance of Nasahi Srasodaram can be proved. Thus, nasal route is a direct entry to the CNS. Thank you so much.
Thank you, doctor. So next I invite Dr. Devyani P. Dasar.
Dr. Devyani, are you there? Next I invite Dr. Ganesh B for the poster presentation. Dr. Ganesh, are you there? Dr. Ganesh, are you there? Next I invite Dr. Aniket for the paper and poster presentation. Dr. Aniket Nyandev Sabal for the paper and poster presentation. Dr. Aniket, are you there? Dr. Aniket Nyandev, are you there? Okay, next I invite Dr. Nikita for the paper and poster presentation. Dr. Nikita Gunman Khandekar for the paper and poster presentation. Dr. Nikita?
Yes, sir. Am I
Please.
audible?
Audible, doctor. Please share the screen, doctor.
Okay, sir.
Your screen is visible, doctor.
Okay, sir. Okay, sir. Should I start?
Yes, please, doctor.
Yes, doctor. Okay. Welcome. Myself, Dr. Nikita Gunman Khandekar, PG Scholar, second year, Kriyashari Department, GSC Usmanabad, Maharashtra. My topic name is Shat Kriya Kal. Introduction. So Kriya is basically karma and Kal is time. It means it is the appropriate time for any treatment. Kriya or action. Kriya or action refers to the measures taken in the form of aushad, ahar and vihar with an aim to correct the doshic disturbances. It is correction in sequential order of the abnormalities occurring in the doshas, dushas, and strotas, and a good understanding of Kriya Kal is very important for early diagnosis, prognosis, and for adopting preventive and curative measures. No disease is produced without the involvement of Vata, Pitta, and Kapha. Hence, aggravation of doshas becomes the root cause of all diseases. Symptoms such as pain, burning, sensation, and heaviness occur solely due to Vata, Pitta, and Kapha respectively. The treatment required for any disease must correspond to the dosh concerned. The concept of Kriyakal has been widely described in two separate entities as Rutu Kriyakal and Vyadhi Kriyakal. Under Rutu Kriyakal, normal physiological variations of dosh in respective season has been discussed, and accordingly certain measures are described. Types of Kriyakal, Vyadhi Kriyakal and Rutu Kriyakal. Vyadhi Kriyakal. It is the process of understanding the pathogenesis of disease in consecutive stages and also known as Shat Kriyakal. संचयम च प्रकोपम च प्रसरम स्थान संश्रयम व्यक्ति भेदम च यो वेत्ति दोषानाम च भवेद भीषक सुश्रुत सूत्रस्थान 21/36. Mainly 6 stages were described for the successive manifestation of the disease, that is Sanchay, Prakop, Prasar, Sthana Samshray, Vyakti, and Bhed. Stages of Vyadhi Kriyakal. First stage is Sanchay, second Prakop, third Prasar, fourth Sthana Samshray, fifth Vyakti, and sixth is Bhed. Sanchay. Sahita Rupa Vruddhishchaya. If the accumulated doshas in the respective seeds, it is the first stage of Kriyakal. Pratham Kriyakalaha Ayyaha Karma Avasaraha. It is the early stage to plan the suitable preventive measures. Dosh is going to accumulate in the respective seeds, and causes for accumulation of dosh has been described elsewhere in the book. Accumulated dosh manifests certain symptoms as follows. Vata Samchay Lakshan, that is Jadata and fullness in abdomen. Pitta Samchay, Pittanga, yellowishness of body parts. Alpasantap, mild increase in body temperature. Kapha Samchay Lakshan, Gurutva, that is heaviness in whole body. Glani. Prakop, second is Prakop. Vilayana Rupa Vriddhihi Prakopaha. Accumulated dosh moving to other sites than its main sites. It is the second stage of Kriyakal. Dosh is going to accumulate in the respective seats, and causes for accumulation of dosh has been described. Vata Prakop Lakshan, Shul and movement of Vat in Mahasrotas. Pitta Prakop Lakshan, Amla Udgar, Daha and Ati Trishna. Kapha Prakop Lakshan, Ruchi and Lanastrav. Third is Prasad. Overflowing of dosh from the respective seeds to other places takes place like fermented materials coming out after keeping mixture of yeast, water and flour in a vessel for overnight. As a large accumulation of water and moves haphazardly in various directions, In the same way, dosh also move to different places with the help of Vayu, either alone or in combinations, are as follows, and it is of 15 types. Vata prasar, Pitta, Pitta prasar, Kapha prasar, Rakta prasar, Vata Pitta prasar, Vat Kapha prasar, Pitta Kapha prasar, Vata Rakta prasar, Pitta Rakta prasar, Kapha Rakta prasar, Vata Pitta Rakta prasar, Vata Kapha Rakta prasar, Pitta Kapha Rakta prasar, Vata Pitta Kapha prasar, and Vata Pitta Kapha Rakta prasar. Vata Prakop Lakshan. Vat moves to different places other than its own seats. Painful sensation in Mahasrotas is feel. Pitta Prakop Lakshan, Choshan Shul, like sucking type of pain. Daha, burning sensation all over the body. Emitting smoke from mouth. Kapha Prasar Lakshan, Aruchi, Agnimanda, and Vaman. Difference between Prakop and Prasar. After heating thick ghee, it melts. It is Prakop stage, as you can see in the image. And on further heating of melted ghee produces frothing and reaches top of the heating utensil or comes out of utensil. It is called Prasara stage. Sthana Samshray. Prasrutanam punardoshanam stroto vaigunyaditra sangahasa sthana samshrayah. Agitated doshas spreads to different places and struck somewhere because of obstruction in srotas due to abnormality in srotas is called sthana samshray. In this particular stage of Kriyakal, premonitory signs and symptoms of the disease are seen. It is the Chaturtha Kriyakal. When there is a dosha samurchana in different region, it produces the following disease like Udargat disease, Gulma, Vidradhi, Udar Rog, Agni Vikar, Vibandha, Anaha, Visuchika, Atisar, Pravahika, Vilambika, etc. Bastigat Vikar, Prameha, Ashmari, Mutraghat, Mutradosh, Medragat Vikar, Niruddha Prakash, Upadamsha, Shukadosh, etc. Gudagat Vikar, Bhagandar, Arsha, Vranagat, Vriddhi disease manifest, Urvajatrugat Vikar manifest, Urvajatrugat Vikar, Tvaka disease like Kshudra Rog, Kushta, Visarpa, Medagat Vikar like Granthi, Apachi, Arbut, Galaganda, allergy, Astigat Vikar, Asti Vidradi, Padagat Vikar, Shlipat, Vatashonit, Vatakantak, Sarvangagat, Jwar, Vatvyadhi, Prameha, Pandu Rog, Shosh, etc. Vyakta Avastha. The stage of appearance of clear-cut symptoms of the disease. Cardinal signs and symptoms of the disease are expressed in this stage. For example, Santap Lakshano Jvaraha, increased temperature is observed in Jvar. Sarana Lakshano Atisaraha, excessive passing of watery stools is seen in Atisar. Purana Lakshana Mudaramiti, abnormal enlargement of abdomen is observed in Udar Rog. Bheda Avastha. In case of Vrad, they burst and become ulcers. Certain disease attain chronicity, that is Jirna Jwar, Pravruddha Amavat, etc. Dirgha Kalanubandha refers to two meanings. That is, in this stage, specific signs and symptoms of the disease manifest like Vata Jwar Lakshan, Pitta Jwar Lakshan, etc. And also, it refers to chronicity of the disease. This particular stage of manifestation is very difficult to cure, and it is not treated at the earliest disease, may become incurable. Rutu Kriyakal. Chaya Prakopa Prashamaha Pitta Dinam Yathakramam Bhavanti Ekaishah Shatasu Kaleshu Bhagramanishu. Seasonal variation of dosh occurs in respective seasons, like accumulation of dosh, agitation of dosh, and elevation of dosh takes place in subsequent ritus. Vagbhata describes Rutu Kriyakal along with dosh. In Chaya, increase of dosh in its own place and manifest dislike for things which are responsible for accumulation and like the opposite qualities of substances. Kopa, Kopastun Marga Gamita, spreading of dosh to different places and manifest symptoms of aggravated dosha like Vatprakop Lakshan. Patients may feel ill health and disease may manifest if not taken care at this stage. It manifests premonitory signs and symptoms of the disease or even attain chronicity. Prasham or Shava, dosh attain normalcy in the respective seats and disease will not manifest. Chaya, Prakop and Prasar of Vat dosh occurs in 3 seasons commencing with Grishma. Stages, Chaya, Kopa, Prasham. Vat dosh like Chaya will be in Grishma, Pitta dosh Chaya in Varsha Rutu, Kapha dosh Chaya in Shishir Rutu, Vata dosh Prakop in Varsha, Pitta dosh Prakop in Sharad, Kapha dosh Prakop in Vasanta, Vata dosh Prasar Prashram in Sharad, Pitta dosh Prashram in Hemanta, and Kapha dosh Prashram in Grishma. Chaya Prakop and Prashram are the normal physiological effects on the dosh due to seasons, foods, nature, etc. And there may not be Chaya Prakop and Prashram may not occur in respective seasons. Importance of knowledge of Kriyakal. Treatment is easier if the disease is diagnosed in the earlier stages. When the doshas are controlled in the Samchaya stage of Kriyakal, they cannot proceed further into the consequent stages of Kriyakal. However, if the doshas are ignored, they will proceed further. It will be more strong and deep-rooted, and there will be resistance to medications. So, by understanding Kriyakal, treatment should be done in the earliest possible stage. Knowledge about Samchay and Achay Prakop helps in the selection of proper treatment procedure in the Prakop stage of Kriyakal. For example, Shodhan is the treatment of choice for Apathya Nimitta Samchay Prakop, but in case of Achay Prakop, Shaman treatment is recommended. To break down Samprapti, it is called Chikitsa, that is treatment, and 6 Kriyakals are collectively known as Samprapti. So the subsequence of Kriyakals should be broken down by applying treatment in the earliest possible stage. To attain success in treatment, it is essential to apply proper measures in proper time, starting from the Samjaya stage, that is accumulation of doshas. Therefore, all the 6 stages of Kriyakal require action by a physician in the form of treatment. So these 6 stages are called 6 stages of action. It has correlation with Panchanidan, that is like Samchay, Prakop, Prasar with Hetu stage, Sthana Samshray with Purvarup, Vyakti and Bhed with Rupa and Upashay, and all 6 Kriyakal with Samprapti. It gives idea about the Sadhya, Asadhyata or prognosis of the disease. Kriyakal also helps in to find appropriate time for doing surgery for Shastra Sadhya disease. Kriyakal helps to make treatment plan for particular stage. Timely intervention with appropriate Aushadha, Pathya, Vyayam for the same. Both the short-term and long-term complications can be effectively managed and prevented by breaking the vicious cycle of pathology and thereby enhance the quality of the life of the patient. Correlation between Ayurvedic concept of Kshatriyakal and modern science. Imbalance in 3 dosha. 3 means 3 and dosha means biological factors, that is Vata, Pitta and Kapha, can be correlated with imbalance in the ratio of oxidant and antioxidant molecules or radicals in the cells. The first stage of Kshatriyakal, called Sanchay, may represent the level of oxidative stress which damages the cell structure and its function. Such phenomena may induce somatic mutations and neoplastic transformation in the cells. However, Prakop stage has unusual cell proliferation due to oxidative stress, which may have increased DNA mutations or induced DNA damage and genome instability. The stage of Prasar can be correlated with the cell migration, as oxidative stress can augment tumor growth. Approach of Kshatriyakal in cancer. The concept of Kshatriyakal is applicable for all disorders, including diabetes, rheumatoid, arthritis, and leprosy. However, its use in the diagnosis and treatment of cancer in early stage can be more effective for patients. On the other hand, in modern medical science, the diagnosis of cancer is only possible at the stage of manifestation or stage of complication, resulting in challenging treatment programs. However, a cancer can be diagnosed at many stages of Kshatriyakal, which may lead to more effective and less complex lines of treatment. Various phases for cancer diagnosis and treatment are given below and shown in figure. As you can see the image, hypothetical model of Kshatriyakal to assess the cancer. Here, on my left side, 6 Kriyakal they are mentioned, and here predisposition, diagnosis, treatment, prognosis, monitoring, disease outcome, all can be done by on the basis of Kshatriyakal. Discussion. Due to various factors, the doshas in the body undergo vitation or morbid changes which initiate the process of disease manifestation. It is clear from the above description that various changes involved in the disease manifestation process take place in distinct steps. As the vague symptomologies are expressed in the early stages of disease manifestation procedure, it is necessary for the individual that he or she should be aware of the changes occurring in the body. So a good knowledge of the concept of Kriyakal is very essential for early recognition of the disease procedure. If the dearranged doshas are left unrecognized and untreated, they will gain strength for their further development. The diseases manifested in a particular stage of Kriyakal may even precipitate some other disease in the name of Nidan Arthaka Roga if left ignored. Conclusion. To conclude the topic, following are the points that derive from the compilation. The proper knowledge of Kshatriyakal helps in understanding the process of manifestation, various diseases, as well as to diagnose the disease. The physician who diagnoses a disease and treat accurately according to Kshatriyakal will become a successful practitioner. The knowledge of Kshatriyakal is helpful for knowing the sadhya, asadhyata of disease and also plays important role in treatment. References, Sushruta Sahita, Vidyalan Commentary, Ashtang Hruday, and the National Journal of Research in Ayurveda Science Topic, a study of Kshatriyakal and importance. Thank you.
Thank you, doctor. Next is a poster presentation.
Yes, sir. Okay, so my poster presentation topic is Dhatu Poshan Nyaya. Introduction. There are 4 theories about the modes of Dhatu formation or nourishment as described below. First is Kshirdhadi Nyaya, law of transformation, Kedari Kulya Nyaya, law of transmission, Khale Kaput Nyaya, law of selection, and Ekakalu Dhatu Poshan Siddhant. So first is Kshirdhadi Nyaya, that is law of transformation. According to this theory, Purva Dhatu is converted into Uttar Dhatu as milk is converted into curd, curd into butter, and butter into grit, and grit Gritamand, upper transparent portion of grit, as you can see in the image. So for this conversion or transformation of one dhatu into next dhatu, it takes 7 days for formation of shukra from rasa dhatu. Some says that it takes 30 days for dhatu transformation to be completed. So drawbacks of this nyaya, according to this theory, the whole rasa dhatu is converted into rakta and the entire rakta into mounts and so on up to shukra dhatu by 7th or 30th day. If a person fasts for 7 or 30 days, the entire body should either become shukramay or it should have perished because of absence of all dhatus except shukra. If rasa dhatu is defective, all dhatus next to it will be defective as they're formed from rasa. Meda Vriddhi should result in Asti Vriddhi by this law, but in practice, it is not seen so. This theory cannot be applied in case of certain aphrodisiac, antitoxic, and Rasayan dravyas as they directly act on particular tissue. For example, milk is Rishya, that is, it immediately acts on Shukra Dhatu after consumption. So this cannot be explained by this law, as according to this, it will take a month to act on Shukra Dhatu. Justification of this nyaya, formation of dhatus takes place serially. The dhatus are divided into 3 parts, Sthula Ansha, Sukshma Ansha, and Mala Ansha during their transformation. The Sthula Ansha forms sthai or stable dhatu. Sukshma Ansha is nutrient portion of next dhatu, and this Sukshma Ansha gets transformed into next dhatu when it goes to specific strotas. Thus, there is no question of complete transformation of dhatus. So there is an image of showing Kshirdhadi Nyaya shortly. Whatever the Panchabhautik ahar we take, Jataragni acts on it. Sarbhag is formed, Malabhag is formed. Then Sarbhag gets converted into 3. Malabhag, Sthula Dhatu Bhag, and Sukshma. From Sthula Bhag, the Dhatu is formed, and from Sukshma, the Upadhatu and the Uttar Dhatu, Ansha, Rakta Nirmana Ansha is formed. So as such, you can see in the image, Uttar, the Dhatu formation is done. Second law is Kedari Kulya Nyaya, that is law of transmission. According to this theory, the process of nourishment of tissues can be linked to irrigation of different fields by water from a canal. From this law, it is clear that dhatus are nourished by ahar ras through specific dhatuvah srotas or canal, and with the help of dhatuvagni, a part of ahar ras or dhatu poshak ansha nourishes the specific dhatu. This law also indicates that rasa dhatu is nourished earlier than maunsa, as it is nearer to chanal, and maunsa dhatu is farther away. By this law, action of milk on shukra can be explained. Also, it is very clear that Meda Vriddhi cannot necessarily cause Asti Vriddhi. So, Kedari Kulya Nyaya representation, whatever ahar we take gets converted into Prasad Bhag and Kitta Bhag. Then on the Sar Bhag, the Rasagni acts, it gets converted again into Sar and Kitta Bhag. From Sar, Rasadhatu and Upadhatu is formed, and the Kitta gets excreted. Then secondly, Raktagni acts, again Sar and Kitta, Rakta Dhatu gets formed, and Upadhatu gets formed. So accordingly, Uttar the Dhatu formation is done. The third Nyay is Khali-Kaput Nyay, that is law of selection. According to this theory, process of nourishment of dhatus takes place by selection. Khala means khalia or field, where in the grains or hip after cutting the crop. Kaput means pigeon. So Khali Kaput Nyay means selection of individual items of requirement by individual dhatwagnis from Ahar Ras, which can contain all the nutrient principles. So as you can see in the image, whatever the Sar Bhag is taken, it is taken by individually, that whatever the need is, if Rasa Dhatu gets formed, individually the nutrition is taken. So by this law, action of milk on sugar can be explained. Also, it is clear that Medha Vriddhi cannot necessarily cause Asti Vriddhi. Also, it is not necessary that white-headed Rasa Dhatu should lead to white-headed Dhatus. Last, fourth Nyay is Ekakala Dhatu Poshan Siddhanta. This principle was said by Acharya Arun Datta, the commentator of Ashtang Hruday. With the help of Vyan Vayu, Ahar Ras nourishes all dhatus at a time without interruption throughout life. This is also known as Ekakala Dhatu Poshan Nyay. This law is universally accepted without any criticism. So, thank you.
Thank you, Doctor. So before going to next presentation, dear participant, once again, I would like to remind you the time duration is maximum of 8 minutes. Please try to present your topic within that time duration. So next I invite Dr. Vishali Patmakar.
Hi, ma'am. Good evening, the doctor. I am Dr. Rushali Langote, PG second year student, presenting the topic on role of Shodhan and Rasayan in children. Introduction. The Panchakarma is essentially included in Shodhan Chikitsa. Shodhan is more superior than the Shaman Chikitsa. Shodhan removes the whited doshas. Panchakarma comes under the Apathya therapy. The various steps of Panchakarma such as Vaman, Virechan, Basti are recommended in early childhood for the management of different abnormal physiological conditions. Panchakarma in Balrog. Panchakarma detoxify the whole body, and the Panchakarma named as Vaman, Virechan, Basti, Nasya, Rakta Mokshan. Vaman. It helps to eliminate the kapha dosha and the opens pranvahasrotas, which may block due to the accumulation of kapha and kaphaj vadi. In kaphaj vadi, Virechan may helps to eliminate the kapha dosha and thus opens pranvahasrotas vadi. Shvaskas, where pitta dosha is predominant. In cerebral palsy, seizures, hearing impairment, and mental retardation are treated with the Panchakarma Chikitsa. Rasayan in Balrog. Rasayan requires precautionary measures while used for childhood care. Pranakamya Rasayan helps to achieve the best quality of pran, thus improve the functioning of cardio and respiratory system. May the Kamya Rasayan improves the mental health. Trikamya Rasayan promotes the complexion, while Naimitic Rasayan combats against the specific cause of disease. Rasayan therapy offers following health benefits in pediatrics. Rasayan boosts the salivary secretion, thus to maintain appetite and digestion. Rasayan effectively cure the digestive alignments related to children disease, that is diarrhea, indigestion. Rasayan improves the immunity, therefore provide resistance against the common infectious disease. Rasayan improves mental health. Rasayan maintain metabolic rate and regulate the process of detoxification and prevent formation of arms. The mode of action of Rasayan in pediatric diseases. The Rasayan improves nutritional value of Rasa Dhatu and improve the Dhatu portion. This Dhatu Vardak and Agni Vardak action of Rasayan contributed towards the Dhatu Nirman. And formulations of Rasayan. Chavanprash, ब्राह्मी घृत, शतावरी घृत, धात्री रसायन. Thank you.
Thank you, doctor.
Thank you.
Next is the poster presentation, doctor.
सॉरी सर, वो जो अभी मैंने प्रेजेंट किया वो तो पोस्टर प्रेजेंटेशन था, और अभी मुझे जो प्रेजेंट करना है वो पेपर प्रेजेंटेशन है.
Okay, doctor. So next is a paper presentation by Dr. Vishali.
Okay. The topic of my paper presentation is the Ayurvedic Management of Cerebral Palsy, a case study. Abstract. क्या मैं कंटिन्यू कर सकती हूँ मैम अभी?
Doctor, please wait. Dr. Sabin will share it once again.
Dr. Vishali, please continue, doctor.
Abstract. The cerebral palsy is common chronic motor disability among the developmental disorder. The cerebral palsy is known as progressive neuromotor disorder of cerebral origin. In Ayurveda, Panchakarma procedures like Sarvangan Snehan, Shalishashtik Pindaswet, Matra Basti are found to beneficial in the management of cerebral palsy in children. The present study reporting a case of cerebral palsy diagnosed and observed marked improvement. Introduction. The disease is otherwise known as little disease. The cerebral palsy can be considered as a janmabal pravritta vyadhi. It can also cause due to the shiromarmabhighatatva vat vyadhi, where marmabhighatatva occurs due to various causes which are garbhapurvak, prasavpurvak, prasavakalin, and prasavottar. The management of cerebral palsy done with the considering is the vataka pradhanta. Shodhan chikitsa like Snehan, Shalishashtik Pindaswet, Matra Basti, Nasya are the main line of treatment. Shaman chikitsa, Brahmi Grita Sevan, Deepan Pachan done with Am Pachak Vati, Krumikuta Ras for 7 days. A case report. The patient information is the age of the patient is 6 years. The socio-economical status, medium, religious, Hindu. Chief complaints of the patient are mentally unstable, unable to correlate the things, poor concentration, unable to do normal activity. Patient was unable to sit, stand, and walk without any support. Can speak by syllables. Vartaman Vyadhi Vritta. The patient was delivered by full-term normal delivery, but did not cry immediately after birth. The ventilation, bag and mask ventilation was given at the time of birth at the in an ICU for 6 to 7 days. The baby suffered from birth asphyxia. Purva Vyadhi Vritta. Purva Vyadhi Vritta. The patient was suffered from birth asphyxia and admitted in an ICU 6 to 7 days for the management of birth asphyxia. Birth history. Baby did not cry immediately after birth. Birth weight of the baby was 2.8 kg. History of immunization. All immunization done as per the schedule. Diagnosis, cerebral palsy, and materials and methods. The place of the study, the Siddhakala Ayurveda Mahavidyalaya, IPD in pediatric ward, Sangamner. The total duration of the treatment was 3 months. Criteria of assessment: the anthropometrical measurement, reflex scale, Ashworth scale for measurement of spasticity. Treatment protocol. The total duration of the treatment is 3 months, in which Panchakarma procedure, Shodhan and Shaman was given. Treatment protocol. Treatment in first sitting. for first month, Shodhan Chikitsa, 7 days Pachan, and Deepan Chikitsa, followed by 15 days Snehan by Balatel. Shalishastic Pindaswet with Ashwagandha, Bala, Kavajbit Churna, 1 spoon in it. Natsya with Panchendriya Vardhan Tel, 2 drops BD. Saman Chikitsa, Brahmi Grit, 1 spoon BD with hot milk. Second month treatment in second sitting, 10 days Matra Basti. 2 such courses were done with interval of 1 month. After that, 10 days gap, again Natsya for 10 days, Shirodhara for 10 days, simultaneously Snehan by Balatel with Pindaswet with Ashwagandha, Bala, Kavajbij, 1 spoon, and Natsya with Panchendriya Vardhan Tel, 2 drops BD. Shaman Chikitsa. Hingvashtak Churna, 1 gram twice a day before milk with lukewarm water. Treatment in third sitting, third month. Snehan by Balatel with Shalishastic Pindaswet, Ashwagandha, Bala, Kavajbit Churna, 1 spoon, Natsya with Panchendriya Vardhan Tel. Shaman Chikitsa, Brahmi Grut, 1 spoon BD with hot milk. Shodhan Chikitsa used drugs are Dipan Pachan with Hingvashtak Churna, 1 gram twice a day before milk with lukewarm water. Snehan with Balatel. Swedan with Shalishastic Pindaswet. Natsya, Brahmi Grita, Matra Basti. The Basti was given with the Bala Swagandhadi Tail, followed by 15 days. Shirodhara. Shirodhara done by Shirodhara Tail for 15 minutes. And Shaman Chikitsa, Brahmi Grit 5 ml with hot water before put twice a day. Exercise, pulling the rope, forward bending. Observation and result. Improvement in growth was achieved by the nourishment of Prasadi Dhatu, Sarvanga Snehan with Balatel causes Gruhan effect. Effects of Sarvanga Snehan. Balatel was used for Sarvanga Snehan. Sarvanga Snehan have Vat Anuloman, Mardavakam, Vat Kapha Nirodhan. Effect of Shalishastic Pindaswet. Shalishastic rice is Digdha, Balavardhan, Dehada Adeprit. Shalishastic Pindaswet increase the blood flow, relieve muscle spasm. The Sarvanga Snehan and Shalishastic Pindaswet accumulately help to reduce the spasticity. The effect of Matra Basti. The effect of Basti at gastrointestinal system as well as it definitely effect on other system also. It helps to control and regulate the system of cerebral palsy. Effect of Shirodhara. Shirodhara deeply relaxes the nervous system. Shirodhara also helps the mood stability. It regulates the treatment, increase blood circulation to the brain, improvement the measure, improved memory and sound sleep, and calm body and mind. Anthropometrical measurement. Parameters, height in inches. Before treatment, height is 100 centimeter. After first setting, height also is 100 centimeter. After second setting, height is increased 102 centimeter. After third setting, height is 106 centimeter. Weight in kg is 12 kg. After first setting, weight is 12.5 kg. After second setting, the weight is 14 kg. And after third setting, the weight is 16 kg. Head circumference. Before treatment, 40 centimeter. After first setting, 42 centimeter. After second setting, 42.2 centimeter. After third setting, 43 centimeter. Chest circumference. Before treatment, 42 centimeter. After first setting, 42 centimeter. After second setting, 44 centimeter. After third setting, 44.1 centimeter. The measurement of muscle power. Before treatment, upper limb to the measurement of muscle power before treatment, upper limb 2 by 5. After first setting, 5 by 3. After second setting, 5 by 3. And after third setting, 5 by 4. Lower limb muscle power. Before treatment, 5 by 3. After first setting, 5 by 3. After second setting, 5 by 4. After third setting, 5 by 5. Ashworth scale of measurement of spasticity. Before treatment, upper limb 3 by 0. And after first setting, 3 by 0. After second setting, +1. After third setting, 3 by 2. Before treatment, 3 by 0. After first setting, 1. After second setting, 3 by 1. After third setting, 3 by 3. The discussion. This case study shown 75% improvement in global delayed milestone, neck holding, and improvement in sitting. The improvement has been achieved by nourishing Rasadi Dhatu. Sarvanga Sneha nourishes the body by Mridi Snigdha Guru Pichil Gun. Shalishastic Pindasvet helps in reduction of spasticity. Matra Basti has capacity to specify and regulate the Vata dosh. Nasya Karma and internal Chaman Chikitsa shows calm effect on the body. The various Panchakarma also helpful in the management of cerebral palsy like Udvartan, with the karma, etc. Udvartan helps to do Rukshan karma of the body and remove the obstruction from the strotas. According to the modern management of cerebral palsy, is not specified symptomatic treatment. Is prescribed like a seizure, tranquilizers are administered. Muscle relaxant for improving muscle function, baclofen and tizanidine helps to reduce spasticity. Dantrolene sodium helps to relaxation of skeletal muscles. Such type of treatment also given in the management of cerebral palsy. Conclusion. The selected Ayurvedic treatment modify the effective in relieving signs and symptoms like spasticity, appetite, and improve bowel habits, and thus reducing the spasticity in child with spastic cerebral palsy, along with improvement in muscle tone and muscle power. Matra Basti and Shirodhara have good result in this case. Thank you.
Thank you, Dr. Vishali. So next I invite Dr. Aniket Survey for the paper presentation.
Yes, ma'am.
Hi.
Sir, can you play my PPT?
Okay, doctor, just a second.
Hello and good evening, everyone. This is myself, Dr. Aniket Surve, final year surgery resident from Anna Saheb Dange Ayurved Mahavidyalaya, Ashta, Sangli. My topic is about the esophageal cancer. Yes. So my topic is about the esophageal cancer. Introduction. The carcinoma of the esophagus is common in the China, South Africa, and the Asian countries, whereas in India it is common in Karnataka and Orissa. It is less common in America, Europe countries. It is the sixth most common cancer in the world. It constitutes less than 1% of cancer, account 7% of GI malignancies. Next. The anatomical specialties. The lack of serosa. This cancer contain the lack of serosa. Other structure without serosa is rectum. The contain two different types of muscles, that is stratified and smooth muscle at proximal 1/3 and distal 2/3 respectively. The segmented blood supply contain two different types of epithelium. The longitudinal arrangement of veins and lymphatics. These are the anatomical specialties for this type of cancer. Next, epidermology. Approximately 17,000 cases of esophageal cancer occurs annually in the United States, and about 480,000 cases in across the world. The worldwide, the squamous cell carcinoma, that is SCC, is the most common, but in the United States, the adenocarcinoma is frequent. During the 2020 years, the incidence of adenocarcinoma has been risen dramatically. Next. The incidence rises steadily with ages peak with the 6th and the 7th decade of the life, whereas the male and female ratio is 3.5:1. The squamous cell carcinoma usually occurs in the middle third of esophagus. The ratio of upper, middle, and lower is 15:50:30, whereas the middle esophagus cancer is prominently seen. The adenocarcinoma is commonly common in the lower third of the esophagus. Next, the risk factor for the SSC, that is the causative factors, the alcohol and tobacco habitual person, the male genders 4 times more common, the Palmer vision syndrome, achalsia cardia. These are the symptoms in which this squamous cell carcinoma is commonly seen. Next, the risk factor for SSC, the patient with the history of the caustic ingestion, the nitrosamines, the vitamin A and C deficiency, the mycotoxins, the genetic abnormalities which contain cyclin D1 and EGFR mutations. These are the genetic abnormality caused by the mutations. Next, the risk factor for the adenocarcinoma are the Barrett esophagus, GERD, hiatus hernia, obesity, smoking, the male gender, the more common among the American and the African Americans. Next, the spread of the CA esophagus, direct, lymphatic, and hematogenous. Next, the direct spread. The lack of the serosal layer in the esophagus favors to local extension. It may be perforate and causes the mediastinitis. It may get the adherent to pleura. The bronchoesophageal or the tracheoesophageal esophagoaortic fistula can be occur in the advanced cases. That is direct spread of SSC. Next, next is lymphatic spread. It is spread by the lymphatic permeation and the lymphatic embolization. It can be causes the satellite nodule in the esophagus away from and it may be the main tumor. The above in the neck is spread the supraclavicular lymph node. In the thorax, the spread of the paraesophageal, the lymph node is dramatic lymph node, diaphragmatic lymph node. In the abdomen, it spread to colic lymph node. The spread occurs to liver, lungs, brain, and bones. Next, the clinical feature for SSC. The recent dysphagia is the most common feature. The 2/3 of lumen should be occurs to cause the dysphagia. Regurgitation anorexia, loss of the weight, sub abdominal pain, ascites due to the second in the liver, then melena and bronchopneumonia. Next, the other clinical features like the hiccups, the phrenic nerve involvement due to the phrenic nerve involvement, the back pain due to the nodal spread, and the left supraclavicular lymph nodes may be palpable. Next, the investigation will show the shouldering sign and irregular feeling of defect. Next, these are the investigation occur by the endoscopic examination, esopharyngoscopy to see the lesions and extent and types. This can be diagnosed by endoscopy. Next, investigation. Further, the investigation can be diagnosed by the biopsy first for the histological types and confirmation by the chest X-ray to look for the aspiration and pneumonia, bronchoscopy to see the invasion in the upper third growth, the laryngoscopy to identify the vocal and the palsy. Next, these are the investigation. The esophageal ultrasonography and the CT scan can be done. Next, the investigation also include the UHG abdomen to look for the liver and the lymph node of the status in the abdomen. Next is endoscopically esophageal staining and the label iodine. Here the normal mucosa is stained brown and carcinoma is remain pale. Next investigation is laparoscopy. It is useful to see the peritoneal spread, liver spread, and the nodal spread. The biopsy from the different spaces can be taken. It will prevent the unnecessary laparotomy. Well, PET or the CT scan is used for the staining and staging and see the response to the therapy. Next, the newer modalities of the evaluation, the flow cytometry, P53 immunohistochemistry, the optical coherence tomography, and the spectroscopy. Next, diagnosis and staging. The esophageal CA is almost diagnosed by the endoscopical biopsy. The endoscopy should be performed in every patient with a dysphagia. Every patient with a dysphagia, even in the barium meal esophagus is suggestive the mortality of disorder. CECT, the chest and the abdominal PT scan evaluate the distal metastasis of the disease. If there is any evidence of the distal metastasis disease, the EUS should be performed to assess the T stage and the regional lymph nodes. Next, these are the TNM classification according to the stage of
Doctor?
Yes.
Doctor, you're exceeding the time limit. Please
Okay.
make it fast.
Next. The treatment principle, if the nodes are the present, then multi-node approach should be used, like the curative resection and the radiotherapy. Next, and chemotherapy. The treatment next. The indication for the curative treatment, the early growth when the patient is fit, when there is no involvement of the adjacent esophageal stricture of the bronchus, liver distant organs. Next, the esophageal indication for the palliative therapy. 80% of patients have the advanced tumor, and at the time of the presentation, the nodes are the greater than 5 involvement. The length of the involvement is more than 8 centimeter. Abnormal esophageal axis in the barium state. Next, the indication for palliative therapy to relieve the pain, to relieve the dysphagia, prevent the bleeding, and prevent the aspiration. Next, these are the palliative surgery, palliative procedure, that is the external and the intramural RT, bariotherapy, chemotherapy, the intubation tube, endoscopical therapy, and the surgery. Next. Next. Okay. Thank you.
Thank you, doctor. So next I invite Dr. Devyani P. Dasar.
Yes, ma'am. I'm here only. Is my voice is clear, ma'am?
Yes, doctor. Clear, doctor.
Yes. I'm going to share the PPT. Is it visible, sir?
Yes, doctor. Visible, doctor. Please start the session.
Yes, sir. And is it moving forward, sir? No.
No, doctor. Now it's moving, doctor. Now it's moving.
Okay. Thank you so much, Ayurveda organization, for giving this opportunity to me. This is a national conference on Karmanya 2023 organized by Ayurveda organization on 26th August 2023. Myself, Dr. Devyani P. Dasar. Myself, Dr. Devyani P. Dasar, Associate Professor from Department of Shalyatantra of Mahatma Gandhi Ayurveda College, Hospital and Research Center, Datta Meghe Institute of Medical Sciences, Savangi Meghe, Wardha. I'm going to present on the role of Agni Karma therapy in Janusandhigat Vata with special reference to osteoarthritis, a case series. So these are the prospects of the today's presentation with the introduction, aim, objectives, methodology, observation, results, conclusion, and discussion. This is the IEC certificate of the research work. This is the certification from the declaration of Namaste portal and the no conflict of interest. This is my research profile with research project as 2 completed, 1 in process. Guided research projects are 4 completed and ongoing 10, including PhD, PG, STS, and interns. With the total publications is 27 and paper presentations with the is awards. So the Sandhigat Vata containing the Shula Shofa and the Sandhi Lakshanas. It can be correlated with the osteoarthritis, which is the second most common rheumatologic problem with the prevalence rate of 22 to 39% in India. Acharya Sushruta said about the Chikitsa Upakrama Sneha Upanaha Agnikarma Bandhana Mardhanani cha Snayu Sandhi Asti Samprapte Kuryat Vaiva Tandrita, and also the Asruka Vimokshanam also Acharya mentioned. This is a systematic review of literature. The articles are collected from the sources of PubMed, Google Scholar, Dhara, Helpline for Ayurveda Research Articles, Ayush Research Portal, and Cochrane Library. This is a review of literature having the Prisma flow diagram. Here, the identification of the records. Afterwards, the screening of the records and duplicates are removed. Then eligibility of that full text articles assessed. And some of the reasons that removed are the depicted here, and included finally quantitative synthesis means meta-analysis articles are 8. Aims and objective evaluation of efficacy of Agni Karma in the management of Janusandhigat Vata with the objectives to study the efficacy of Agni Karma in Janusandhigat Vata in goniometric scale assessment, that is a flexion and extension and pain at the joint, and to study the efficacy of Agni Karma in Janusandhigat Vata in Kalgren-Lawrence scale and swelling on the joint. So this is a research design with the reference standard control single blind clinical trial with the total 100 patients and randomization done by the computer generated number methods with the objective parameters goniometer scale assessment and Kalgren-Lawrence scale, and subjective parameters pain and swelling at the joint. Materials are the here number of patients is 100, included 45 to 60 years of age with the Agni Karma intervention with the duration 6 weeks and follow for the next 6 weeks, weekly ones for 6 weeks. And these are the materials we already know the Agni Karma materials required, including the Shalaka, also aloe vera, Kumari pulp, Triphala Kasha, Yashti Madhu Churna with the dressing materials. Here the Purva Karma selection of the patient with the investigation and structured written consent. Abhyanga with the Dashmal Tel Nadi Svedana with Nirgundi Patra and Trifala Kasha and Agni Karma Shalaka. Pradhan Karma Samyak Dagdha was made on the affected part in Bindu Pada nature. After that, Kumari pulp dressing done. So these are the photographs of the photographs for the research projects. Whatever the Agni Karma procedure I did, this is the material, this is one, and this is the goniometer scale assessment. Justification for the sample size with the article source of Jetwa and Dudmal with the formula source are from the Duke University School of Medicine, North Carolina. This is the inclusion criteria which already we discussed. Exclusion criteria, especially knee joint fractures, history of joint replacement, history of hemophilia, infections at the knee joint, also multisystemic disorders, pregnant and lactating females are excluded. So criteria for the assessment variables already I just explained. So these are the scale for the assessment: goniometer, Kellgren-Lawrence scale, pain at the joint and swelling on the joint. This is a software used for the statistical analysis. SPSS 25 version with the piece less than 0.5 is considered a label as significance, and chi-square pair t-test. So demographic data, everything I got significance with the sum of the non-significant values. So this is also demographic data regarding diet, habitat, occupation and addiction with the sleep, lifestyle and cheek components. So this is the goniometer scale assessment, that is a flexion in Agni Karma in 1 and 6 weeks. The result, I got the significant p-value. Here again, in the terms of extension, I got the significant p-value. And in range of motion in Agni Karma in week 1st and 6th, I got the p-value significance. And effect of that therapy, Kellgren-Lawrence scale, here I didn't get any result before and after, because this is the radiological scale and I didn't get anything. So values were same. Pain at the joint, here I got the significant difference in this one, and swelling on the joint is also I got the significant. Overall therapy shows that this significant p values with the mean and SD and t values in front of you, that is also depicted in the slides. So pain and the swelling on the joint, here also I got the significant results. Effect is, it showed significant result in improving goniometer scale assessment in terms of flexion and extension, but Agni Karma on Kellgren-Lawrence scale didn't show any significant changes, and intervention also shows the pain at the joint and swelling on the joint is efficacious Agni Karma therapy. So conformity with the objects is the Agni Karma is as efficacious in reduction in goniometer scale assessment, also in reduction of the swelling and pain on the joint. Other joints I had not studied, and other types of Sandhigat Vata is also not studied, and sample size was statistically estimated. These are the limitations of my present study. This is the novel contribution of the scientific literature. This is the references. Thank you so much. Thank you, IRAPTA organization, for giving such a nice platform to me. Thank you so much.
Thank you, Dr. Devayani, for this wonderful presentation.
Thank you, Doctor.
So next I invite Dr. Chitravina Nibrat. I invite Dr. Chitravina. So next I invite Dr. Tripti Thakre.
Yes,
I invite Dr. Tripti.
Good evening, sir. Good evening, ma'am. Myself, Dr. Tripti Thakre, Assistant Professor, Department of Kamabhrutya, Mahatma Gandhi Ayurvedic College, Hospital and Research Center, DMIHR, Vardha. My study title is Comparative Study on the Effect of Medicated Oil Enema and Medicated Ghee in Karsha. Next, please. Karsha is one of the major diseases explained in Ayurveda as a Swatantra Vyadhi and Paratantra Vyadhi. By analyzing the causative factors like Vatavardak Ahar Vihar of Karsha, we can understand that it is a nutritional deficiency which is mentioned as Apatarpajanya Vyadhi in Charaka Samhita. Altered function of this Vayu and Agni leads to insufficient production of Dhatu, especially Rasa Dhatu, because of vitiation of Dhatwagni, especially Jatharagni and Dhatwagni. So Upashana of this Rasa Dhatu takes place, leading to Dhatukshay chronologically. Hence, the patient of Karsha suffer from indigestion, malabsorption, and defective metabolism. Meda and Mamsadhatukshay at microscopic level ultimately express its symptoms macroscopically, like low weight gain, lack of appetite, less BMI, etc. This sequence are very much correlated to undernutrition in contemporary science. Next, please. Aim and objective to study the effect of to study the comparative effect of Shirabala Tel Matra Basti and oral administration of Dhatri Paisadi Grita in Karsha, which is explained in Arogya Raksha Kalpadhruma textbook of Baldro. Objectives are to study the efficacy of Shirabala Tel Matra Basti on anthropometric value and other Lakshana of Karsha, to study the combined effect of Shirabala Tel Matra Basti and Gruta oral administration in subjective and objective parameters, and to compare the efficacy of both in subjective and objective parameters with serological parameters like HB%, RBC, protein, serum, creatinine. Next, please. Methodology is randomized parallel group, open label single centric comparative clinical trial with CTI number as shown in slide. So this trial was carried out in 36 children, out of which 6 children are dropout and 30 subjects were enrolled successfully in between 3 to 10 years with general signs and symptoms of undernutrition. We are included from the OPD and IPD of our institute. Inclusion criteria are 3 to 10 years suffering from Karsha irrespective of sex, religion, and socioeconomic status. Next, please. Exclusion criteria are subjects suffering from infectious diseases like tuberculosis, HIV, and other systemic disorders, and hyperthyroidism. So grouping were divided, the children were divided into 2 groups, 18 in each. The one group is MB group, in which Matra Basti given only for 7 days in 2 settings with a gap of 7 days, 24 ml in dosage. And in other group, Matra Basti with Dhatri Paisadi group, the oral administration were given for 28 days. These are the ingredients of Dhatra Paisadi Grita. Next, please. Amalki, Ikshu, Bala, Tila, Vidari, and Gruta. Next, please. These are the method of preparation which is prepared in Dattate Rashashala of DMI HER Vardha. Next, please. These are the doses schedule from 3 to 10 years as shown in slide. Next, please. So subjective parameters were selected from the context of undernutrition in Ayurveda classics such as impaired digestion like Agnimandya, Twakarukshata, intolerance to beer thirst means Tushnaasna Ishnuta, Shudraasna Ishnuta, which are assessed on 0, 7, 14, 21st and 28th day of trial, which is graded according to severity as 3 to 10 for severe, moderate, mild and absent respectively, along with the anthropometrical parameters. In objective parameters such as hemoglobin, RBC, serum protein, serum creatinine were noted in respective values on 0th and 28th day of the trial. The obtained result based on the above parameter when analyzed by Wilcoxon rank test and student paired t-test. Next, please. Next, please. So these are the tables of symptoms and number of subjective reported in the complaint. In Agnimandan Twakarukshata reported in all the children's, and we got result near about 50% in one group and 50% in the other group, in which Matra Basti and Dhatri Paisadi were given. In Angasada, Trushnasna Ishuta and Dorbalya also we got 50% significant result. Next, please. Next, please. In anthropometrical parameters, in weight and BMI especially, we got significant result in second group, that is MBD group, in which oral administration of Dhatri Paisadi Grit and Matra Basti enema is given. Next, please. In hematological parameters also, the hemoglobin, RBC and serum protein show significant result in second group, in which both oral and Matra Basti were given. Next, please. The probable mode of action of Dhatri Paisadi Grita and Shiravala Tel can be interpreted by the pharmacokinetics and pharmacodynamic of their ingredient. The common parameters in both the formulation was the ingredient having similar qualities and action like Madhur Rasa, Snigdha Guna and Bruhan Karma. So with the prime factors which might have influence and the action of drugs. Next, please. So these are the drugs with the Rasaguna, Virya, Vipak and Karma. Most of the drugs are Madhur Rasa like Oja Vruddhi, Rasayana, Jivaniya, Agnidipana and Balavardhak. Next, please. This is the probable mode of action of the trial drug. Mostly they are act on the Agnidipana, which is ultimately result in Brahmana, Agnidipan, Rasayan, Snehan, and Vata Shamana, which enhance the action of Pachagagni and Dhatwagni, which modifies the absorption and digestion of the nutrients and influence the Dhatu Parinama, means Uttaruttar Dhatu Poshana. And this Uttaruttar Dhatu Poshana pacified the Karsha Lakshana and increase the anthropometrical parameter as well as hemological, serological parameters. Next, please. So conclusion is, in the present study, although significant results were seen in subjective parameters, hemoglobin percentage, weight, and BMI in both the groups, but on comparison, no significant difference were noted. It may be because of less duration, that is 28 days only. So hence, it can be concluded that Dhatri Pasadigrit and Shirabalatel can be effectively used for weight gain in children. These are the references. Thank you.
Thank you, Doctor, for presenting such a wonderful topic. So,
thank you, ma'am.
Thank you, Doctor. Next, I invite Dr. Deepika Chakoli for the paper presentation.
Good evening, sir. I would like to share my PPT. Thank you, sir. Thank you, Ayurveda, for giving me opportunity to present my topic. The topic of my presentation is correlation of incidence of obesity and Charak Sanhita listed Santarpanjanya hetus in office working people in Wardha district, an observation cross-sectional study. So basically, this is my study protocol. Next, please. As we know, the 21st century is revolutionary inventions which leads to less human exertion but increases the sedentary lifestyle of the person as well. So there are plenty of study present which proves the excessive sitting time, that is sedentary lifestyle, which leads to various lifestyle and metabolic disorders such as type 2 diabetes mellitus, hypertension, and metabolic syndrome. In Charak Samhita, there is one chapter dedicated to describe all dietary behavioral hetus for Santarpanjanya Vyadis. There is a list of according Santarpanjanya Vyadi also. So next, please. So this is the shlok. Actually, it is not completely accepted form. So it is a Santarpate, Snigdai, Madhura, Guru, Pichili, Navani, Navamadde. So these are basically hetus of the Santarpanjanya Vyadi. Next, please. So why this study is needed? Why I have to make this study protocol? As I search through many various articles and research prevalence study published regarding the sedentary lifestyle and its consequences, all study explain the sedentary lifestyle as a prolonged sitting or lying position. The indulgence of various food and food items are not specifically involved in all these studies. So this kind of prevalence study is also not done in the Vidarbha region. So this study will helps to establish a relation in between the incidence of obesity and Santarpanjanya hetus in the office working people. So this is actually aim of my study. Next, please. So this will also help to find out the incidence of Santarpanjanya hetu, which will found to be useful in many future Santarpan related study, as there is a high prevalence of all lifestyle disorders. So for better Ayurvedic intervention, there is a need to look into a cost through the Ayurvedic perspective also, as our all Acharya said, Roga Ado Pariksheta Tadanantaram Aushadam. Next, please. Next slide, please. So these are all the previous work done, which is actually the first, as we can see, the first one also is related with the Santarpana and its conceptual study of Santarpana and its hetus. The next one is the Santarpanjanya, Santarpan essential hypertension with reference to Santarpanjanya Vyadi. But there is no study present that incidence of diabetes mellitus and the Santarpanjanya hetus. Next, please. So we have to find out that research gap analysis, though there are many studies done regarding the sedentary lifestyle, but it is always focused on physical inactivity. So these observation studies needed, as in this study, there is an assessment of dietary factors also. So in this study, I will focus on dietary factors which causing the Santarpana, or which come as the Santarpanjanya hetus, and then Vihariya hetu also. There is a one study present regarding the incidence of hypertension and Santarpanjanya hetu, but no study present with the incidence of obesity and its correlation to Charkokta Santarpanjanya hetus. Next, please. So, what is this is the research question of my study, whether there is a correlation in between incidence of obesity and Charak Sanhita listed Santarpanjanya hetus in office working people of Wardha. Next, please. So, the aim of my study will be to determine the correlation between incidence of obesity and Santarpanjani Hetu is in office working people in Wardha district. These are some other objectives I have put in this study. The incidence of obesity in office working people in Wardha district, also the incidence of Aharya Santarpanjani Hetu and Viharya Santarpanjani Hetu. Next, please. So this is the methodology in study. This is actually type of a cross-section observational study. The sample size is done according to the formula, and it is a combination of AO, GO and CO. That is a combined obesity, abdominal obesity and generalized obesity. So sample size of my study is 383 people. The question next. So in this study, this is a flowchart for my study protocol. Office working people visited to in our institute will be screened for the BMI. The people having BMI more than 25 will ask the questionnaire, the form questionnaire for the Santarpanjani Hetu, and analytical and descriptive study will be presented in collected from the collected data. Next, please. In inclusion criteria, I have included a male and female, either gender, about 20 years and more, and office working people specifically having BMI more than 25. In exclusion, the office worker with the excessive physical exertion, for example, fuel, or office working people having a BMI less than 25. And office working people below the 20 are will excluded from this study. Next, please. So assessment criteria for screening, only weight and height will be taken for the BMI. For subjective, we have made a questionnaire for the assessment. It is generated and validated, content validity and the statistical validity will be done for that. And for objective parameters, I have taken waist circumference, hip and the waist hip ratio. Next, please. Scope of study. So why this study, study protocol I have presented, and why this study will needed. So this study will help to establish a correlation in between the incidence of obesity and Charak Samhita listed Santarpanjani Hetu. The formation of assessment tool for Santarpanjani Hetu. This tool can use in many further Santarpanjani related study, and this tool will practically used in patient while deciding Santarpana, Apatarpana Chikitsa for any particular patient. Next, please. So this is the references for my study. Actually this is a study protocol. So after collecting data, the whole study will be presented and published. Thank you. Next, please. Thank you. Thank you for giving me opportunity to present in this seminar, webinar. Thank you, sir.
Thank you, doctor. Thank you for this wonderful presentation.
Thank you.
Thank you, doctor.
So next I invite Dr. Abhijit Ganesh.
Hello, Dr. Abhijit, are you there? Okay, next I invite Dr. Ullas, GP. Dr. Ullas, are you there? Dr. Ullas, are you there? Okay, next I invite Dr. Nidhi RB. Dr. Nidhi RB, are you there? Dr. Nidhi RB, are you there? Next I invite Dr. Shubham Satpute. Shubham Satpute, are you there? Okay, we are come up to the end of the session. Dr. Deepak Gangawane, are you there? Dr. Vashishth Gohel, are you there? Dr. Ganesh B, are you there? Dr. Aniket Sabal, are you there? Dr. Chitravina, are you there? Dr. Shubham Satpute, are you there? Dr. Abhijit Ganesh Mayane, are you there? Dr. Ullas GP, are you there? Next, and finally, Dr. Nidhi RB, are you there? Okay, we are come to the end. I would like to invite Dr. Aishwarya RS to conclude the session.
Thank you, Dr. Sabin. So, thus we come up to the end of our today's presentation, and I would like to congratulate our dear participants for their active presentation. So, we'll meet on September 3rd next. Till that, thank you all. And before winding up, let me thank our faculty members, and I would like to extend my sincere gratitude to our faculty members for spending their valuable time for us. Thank you all.